So, good morning and welcome all. Uh, First of all, I would like to apologize for the delay. Uh, One of our speaker had a bit of a technical problem. So instead of Dr. Narayan Jadhav sir, who was going to talk about Nidan and Samprapti of the respiratory tract Pranvaha Srotas, I will be starting this session. Uh, Good morning. My name is Dr. Rahul A. Jadhav, and I am HOD, an associate professor of SwasthaVritta department. So, yes. So the idea behind this whole seminar was that the 2020 is almost over, and we have suffered a lot between 20 during this whole year. And with that suffering, our understanding of COVID-19 has improved a lot. And this webinar was an effort to give that updated information, that updated understanding. We have heard a lot about COVID. There have been a lot of webinars about it. There have been a lot of discussions. Uh, some of them were fruitful, some of them were not fruitful. And at the end of this year, we can come to that conclusion that what is useful and what is not useful. So this seminar is an effort to give you something useful. So that we all know that this pandemic is going to continue in 2021. It's not going to over here. It's not going to stop here, despite the vaccination, by the way. Um, so I hope that we would be able to contribute something good in this fight against COVID-19. That is the motto of this webinar, that fighting COVID in 2021. So in the first session, I will be talking about infection control in outpatient setting. So infection control in outpatient setting. Uh, the title itself seems like a bit of something which we should have as a common sense. Yeah, of course. We learn about things like this, and we know the importance of protecting ourselves and our patients from unwanted infections. But many times we don't uh, really understand some of the protocols, and we have misconceptions which are completely we have conceptions about few things which are completely false. So I hope so that in this session I will be able to I will be able to remove some of those misconceptions uh, and give you a basic idea of what infection control is in its true essence. So the objective of this session is the participants will be able to understand the problem of infection in the outpatient setting, review some of the outbreaks, but I will be probably skipping some outbreak data, apply principles of infection control in outpatient setting. So when I say outpatient setting, what exactly do I mean? So outpatient setting, so outpatient setting, what basically means is that outpatient care. A care provided in a facility where patients do not remain overnight. Outpatient clinics, it can be a hospital, uh, a non-hospital clinics, like most of us have. We don't have hospitals, we have clinics, which we call the outpatient departments or OPDs. Uh, Freestanding clinics, or even some people who malpractice, basically quacks. Okay, yes. Please enlarge the screen. Yeah, that's it. Okay. Uh, yes, also the people who are the quacks and do malpractice. It can be a DOTS TB center. It can be a dialysis center. Yes, dialysis centers are also an outpatient department. Endoscopy clinic, the ambulatory surgery centers, dental clinics, dermatology clinics, and so on. So these are the outpatient settings that I am talking about, and these can be a very important source of infection for many people. The iatrogenic infections are real. Iatrogenic means physician-induced infections due to the procedure or the environment of that hospital itself. Those are very real and a very big public health problem. The data of such outbreaks is unfortunately not available that in India, but if you go on CDC website, the data is very much available in US. So if the iatrogenic infections are happening in the US with all those safety protocols and everything, I am very sure that they are absolutely happening on a much larger scale in India itself. Uh, yes. Next. Yeah, key administrative recommendations. So what should we do? Let's start with the basic, like I said, the idea of infection prevention. Develop and maintain infection prevention and occupational health programs. Okay, you should have an active program. Actually, government doesn't have an active program in this regard, especially when it comes to outpatient setting infection control. Assure availability of sufficient, but you can develop your programs. The institute, if it is a medical college, it's a hospital, you can have your program. It can be a training program, it can be set up protocols. Many of us have gone through the NABH accreditation. Those people will understand what I'm talking about. NABH, I think it's one of a kind uh, uh, in India till now. I think such an accreditation should exist for OPDs as well. uh, I think many of you will not agree with that. You will say it will be an extra headache, unnecessary headache for general practitioners. But I think it should be, there should be some kind of accreditation, uh, or accreditation to assure the quality of services for the general practitioners and at OPD level also. Second is to assure availability of sufficient appropriate supplies necessary for adherence to standard precautions, like hygiene products or PPE kits, injection equipments, and so on. Assure that at least one individual with training in the infection prevention is employed by regularly or on the contract basis by management of the facility uh, of that outpatient. Okay, that outpatient department, that outpatient setting should at least have one individual who have very proper training in infection prevention. It can be a paramedical staff. Uh, if it is not even a medical staff, it can be a receptionist. Most of the general practitioners have receptionists. They don't have nurses or paramedical staff. So you can train that front desk staff for the infection prevention protocols. Develop written infection prevention policies and procedures appropriate for the services provided by the facility and based upon the evidence-based guidelines, regulations, or standards. You can post this. You can display these policies, okay, on the entrance or whenever, and on the areas where they are most likely to infect a patient or patient is most likely to infect a physician. Educate patients. Patient education is also important as well. Patient education is also important as well. We have to tell the patients should be aware of what kind of infections they might get from an outpatient setting or for during a procedure. because that awareness can create a lot of difference. Because if patients are aware, we have to work more. If patients are aware of certain medical procedure or the consequences of certain medical procedures, they will ask questions. They will be more aware about that, and they will be more aware of the facilities of infection prevention at that setting. If n number of public are aware of that, how important infection prevention is at a outpatient setting or at a dialysis center or at a infusion center, and if they are available aware of it, and if they observe those protocols or those safety protocols there, then it's something, it will elevate everybody's standards. It will elevate our standards as well. We should adapt to the local, state, and central government requirements. We have some of those. Second is hand hygiene. It's a very, very important. I think it's a common sense for us at the moment, even for a public. I think hand hygiene never has been more important in the history of all humankind, ever. I don't think it has been ever that important in the entire human history, if I can say that, hand hygiene. So we know the importance of hand hygiene at the moment, and let me tell you the statistic that 80% infectious diseases that humans contract can be transmitted through your contaminated fingers, through your contaminated hand. So hand is a very big source of infection for many of the diseases. ठीक है, after contact with patient or object, ठीक है, so hand hygiene, so hand where is important, at which situations hand hygiene is very important. You all of you know this, it's very basic, but just let me summarize it. The key situations where hand hygiene should be performed: before contact with the patient, before performing an aseptic task, after contact with the patient or objects in the immediate vicinity of the patient. We should be constantly aware of what our fingers are touching. हमारे फिंगर्स किस किस चीजों को टच कर रहे हैं, इस बारे में हम कॉन्स्टेंटली अवेयर होना चाहिए जब भी हम ओपीडी में रहते हैं या जब भी कोई प्रोसीजर कर रहे होते हैं. ठीक है, यू शुड बी कॉन्स्टेंटली अवेयर ऑफ दैट. It might be a stethoscope, it might be a pen, but when you are sitting in OPD where that patient is talking to you, whether he's wearing a mask or not, he's propelling those droplets in the environment. He's propelling those droplets in that closed environment of your outpatient cabin. So those droplets are going to settle everywhere. Those droplets are going to settle on the mouse of your laptop, your computer, the keyboard of your laptop, your computer, the pen, prescription pad, table, everywhere. So potentially everything in your cabin, in your OPD, can be contaminated. That's why, like I said, you should be always and always very cautious about, not cautious, I would say, very conscious about what your fingers are touching. After contact with bloody body fluids or contaminated surfaces, if hands, and second, if hands will be moving from contaminated body side to clean body side during patient care. So again, this is a very basic thing. Contaminated site, which can be contaminated, which can be site of the body if we are cleaning a wound, which part of wound can be something which can contaminate, and which part of body is something which can be contaminated, can get contaminated by that. So we should be aware of that. After removal of the PPEs, okay, that's I think the donning and undonning of PPDs, we are very well aware of that. What is the procedure and what is the stepwise guide of that? We have seen a lot of those videos and those instructions on the social media and everywhere. So I'm not going to go into the details of how to wear PPEs and how to remove them. But yeah, after removal of PPD, hand hygiene is important. And when I say hand hygiene, what does I mean? Do you have to wash your hands every time? So washing hand is ideal because soap is a very, very excellent disinfectant. Basically, most of the viruses are covered with this lipid envelope, and the soap its emulsifying qualities can dissolve those lipids. So that capsule of the virus can get dissolved very quickly when it comes in contact with the soap. So soap is a very ideal disinfectant, but practically soap cannot be used everywhere, and we cannot wash our hands every time. Okay, that's not practical. So when I say hand hygiene, most of the time I'm referring to alcohol based hand gloves. ठीक है, हैंड सैनिटाइजर्स, अल्कोहल बेस्ड हैंड सैनिटाइजर्स और हैंड डिसइंफेक्टेंट्स, ठीक है, बट you should use soap whenever your hands are visibly soiled with blood or body fluids. Otherwise, use alcohol based hand. Use of PPE in outpatient setting. Facilities should assure that sufficient amount of PPEs are available for all the staff. So use of personal safety equipment is always better. It will assure the ultimate infection prevention in outpatient settings. The only problem is that you should be very, very aware of how to wear those PPEs and how to remove those PPEs, how to dispose them or how to reuse them, because most of the infection will happen during that time. Wear gloves for potential contacts with blood. This is very basic. Do not wear same pair of gloves for the care of more than one patient. Again, very common sense. Do not wash gloves for purpose of reuse. Yeah, that is not a very good idea. Most of us, but washing gloves and then using them for other patient is not okay. It will put that patient to the risk of infection. Wear a gown to protect skin and clothing during the procedure. Yes, you should wear a gown because many procedures can develop aerosols like endoscopy. Okay. So you should wear a gown because those aerosols can contaminate your fabric of the clothes you are wearing. Okay. And the virus can remain active on that fabric for many hours. A virus or bacteria. So your contaminated your own clothes can be source of infection for yourself and your patients as well. Do not wear the same gown for the care more than one patient. Again, I don't think everybody follows that because not endoscopy physicians, the physicians or surgeons who are doing endoscopy, they don't change the gown for every patient. But unfortunately, that can be a very important source of infection for other patients. Wear mouth, nose, and eye protection during the procedure that are likely to generate splashes or splays of blood or otherwise, like aerosols. Aerosol generation करने वाले कौन से भी procedures में we have to wear mouth, nose, and eye protection. Safe injection practices. Again, very common sense. All of us are very aware of these things. Use aseptic techniques, obviously. Clean the areas, the access diaphragms of the medication vials with alcohol before inserting a device into the vial. The most of us don't do this. We should clean the access diaphragm. There is a plastic access diaphragm through which we insert that needle into that vial. So the ideal guidelines say that we should clean that area with alcohol as well. In the same way that we clean the skin of the patient where we are going to inject the needle. Never administer medications from the same syringe to multiple patients. Again, very common sense. Uh, do not reuse the syringe. Yes, all of us follow that. Do not administer medication from a single dose or single use vial. Unfortunately, all of us does this. We use the same vial to administer medications, uh, but that's debatable. It cannot be probably a source of infection, but it's not pharmacologically very ideal. Do not use fluid infusions or administration set for more than one patient. We know that. Dedicate multi-dose vials to a single patient whenever possible. In many conditions, it's not possible, but we are supposed to do that. So best way is using the ampoules. Personally, I myself have stopped using vials in my practice a long ago. So we should definitely use ampoules only. None of us do that. Saline bags, we generally don't use the same saline bag for more than one patient. But obviously, it's not ideal. It will definitely will lead to the infection. If that the patient is the first patient is it does have a viral infection, and if we use the same bag for another patient, it can be a source of infection. Dispose of the used sharps at the point of use in a sharp container that is closable, puncture resistant, and leak proof. Wear face masks. Some common disinfectants Mixture of phenol, cresol. Actually, we can use crude phenol in 10% strength for disinfection of feces, or in 5% to mop the floors of your OPD or your whatever the setup you have. There is cresol emulsion. We know that cresol emulsion with the name of Lysol. Lysol is very famous. So Lysol is, in my perception, is a very, very, very ideal disinfectant when you have to disinfect surfaces. Okay, it can be a surface, it can be a flooring, or it can be a surface of your OPD, your cabin table, or it can be your examination table. You have to clean those surfaces. Lysol is very, very ideal. Lysol contains actually 50 to 60% cresol and 2% solution. Even a 2% solution can disinfect feces. Generally, we need stronger strengths to disinfect feces, but even a 2% solution of Lysol can disinfect feces. Then there is Savlon. You can use Savlon to disinfect instruments, plastic instruments basically. But the problem with Savlon is that the contact time is more. See, Savlon is not a very potent disinfectant. The potency of Savlon increases when the contact time increases. So you have to dip your instruments in Savlon for more than 3 minutes. It's not like alcohol that you rub it for a few seconds and it's disinfected. No, in case of Savlon, you have to maintain the contact time of more than 3 minutes. Then there are halogen and their compounds. There is bleaching powder, but most of us we don't bleaching powder. What we use is sodium hypochlorite. Sodium hypochlorite, again, like Lysol, is a very, very excellent disinfectant. You can use it to disinfect surfaces and even feces and urine. Iodine tinctures, yeah, use very excellent. Actually, the among all of them, iodine is a it's not a disinfectant, but it's an antiseptic, which is a very broad spectrum antiseptic. But the problem with iodine is that it stains. Okay, it stains the surfaces and clothing, so we cannot use it everywhere. Then there is hydrochloric acid. We use that in our household setting as well. Yeah, alcohols. Yeah, we have to talk about this. Alcohols. 100% alcohol is not disinfection. It does not do disinfection. Okay, I say it again. 100% pure alcohol does not do disinfection because it will evaporate very quickly. So 70% alcohol strength is ideal. If you are purchasing a product from market, any alcohol hand rubs or any spirit or anything else, if it is 100% strength, it will not do disinfection properly. Okay, you have to dilute it. So 70% strength is very, very ideal for alcohol. So alcohol has to stay for some say few seconds on your hands. If you're using a alcohol hand rub and it's evaporating within 3 to 4 seconds, then it cannot do an ideal disinfection. It has to stay there for more than at least 5 seconds. Formaldehyde, again, you can use formaldehyde, but it's a little bit toxic actually. But you can use it for spraying rooms and walls and for spraying on the furnitures. It's a very good disinfectant. Then there is ethylene oxide. It's very toxic. Generally, plastic equipment. Actually, ethylene oxide is used for not only for disinfection, for absolute sterilization as well. Like cardiac catheters, and so they are sterilized with ethylene oxide. Then there are a few things about dialysis, dialyzer reuse, because dialysis units are a very, very important source of infection in outpatient setting. I'm not going to go into the much detail of that because as a fraternity of Ayurveda, we don't have much to do with dialysis. But there are n number of instructions of how to the dialyzer, how to reuse the dialyzer, how to disinfect that dialyzer, and so on. So let's just kill that. Okay, if anybody of you are interested, the lot of information about it is available online. I'm sure that dialysis units in Maharashtra and India are already following these protocols. And the endoscopy centers, again, we don't really have to go into that because most of us don't do endoscopies, or all of us, I can say. These are some best practices for reusing the endoscope. There is pre-cleaning, there is leak testing, then cleaning, then disinfection, then drying and storage. And if I've seen a physician who does n number of endoscopies in a single day, I think most of us can agree that these disinfection protocols are not followed by nearly 80 to 90% of the endoscopy physicians or surgeons. So infection control outside the hospital or your OPD or your cabin. Hand hygiene is very important in restrooms, elevators, counters, gas stations, schools, banks, airports. Personal protective equipments, surgical masks in particular, are important in home when there are more than a few people. Airlines, airports, public transports, shopping centers, schools, churches, you have to wear masks then. It's a very basic thing. I think the mechanism of mask and how masks are important, all of us do know that. So I don't have to go into those details. Thank you. So that's my time. Uh, I hope I could say a few more things. Actually, I have many more things to say about it, but unfortunately, due to time restraints, we have to stop because we were a little bit late to start the session to begin with. Uh, but any of you have any questions? They are more than welcome to ask. I'll wait for 5 minutes. Okay, you can ask the questions. Just go ahead and ask. And one more thing, there is a link in the live chat. If you go in the live chat, there is a Google Form link. You can click that link, fill up the form. The purpose of that is to keep the track of how many people actually saw this and to give them a participant certification. So please follow that link. It's right there in the live chat. Our team will gradually post that link over and over again in the live chat. So keep an eye for it. And please ask any questions if you have. While we are waiting, I think we can safely say, I think we can safely wait for 5 minutes. And while we are waiting, uh, let's talk about something. Let's talk about vaccine, COVID-19 vaccine. Uh, and I can talk about this because it's my subject. So a lot of us have many conceptions, misconceptions, information, misinformation about the vaccination. But for even some of our Vaidyas are raising a very serious concern about vaccination. To all of those people, I would like to say that um, vaccination in its nature is supposed to create few reactions in few individuals. There cannot be a vaccine, uh, at least in the initial stages, which will produce zero reactions. There cannot be a vaccine which will produce zero reactions. There will be some adverse reaction in few individuals. It is the nature of vaccine. The purpose of vaccination is to induce a immunological memory, against a particular antigen. Immunological memory is a uh, like it's like remembering a recipe. So we have this antigen in our system. Which antibody should we produce, or which antibody should we secrete to neutralize that antigen? That memory is important. And vaccine is nothing but a immunobiological sample of that antigen. So we are our immune system, our adaptive immune system is going to engage with that antigen sample, that immunobiological substance, that vaccine. And so when it engages with that, it's going to produce few symptoms in few individuals. The only, I think, adverse, the concerning adverse reaction of an vaccine can be that infection of the virus itself. So it's possible. Again, we don't know the nature of these vaccines. They're not out yet. So as a medical professionals, doesn't matter if we belong to Ayurveda fraternity or allopathy fraternity. As a sane individuals, uh, well-read individuals, we should not oppose vaccination. And even if some of us have the doubts about vaccination, just go and read Adaptive Immune System from Guyton, please. Okay, we have a question. Yeah, yeah. How will you assess the long-term adverse vaccine reactions? Yeah, okay. Long-term adverse vaccine reactions can logically be only explained if the virus is remaining uh, dormant in that individual. If the virus, if it's a live vaccine, again, I'm saying that if it's a live vaccine and somehow that live virus can remain dormant in that individual, then we can talk about long-term adverse reactions. And if that patient develops a very strong reaction, very strong adverse reaction against that vaccine, and if he goes into like systemic shock and all, and that whole pathology has happened, and due to that, that patient will will face some um health concerns or face some ill health for some time in his life. But I don't think that has something to do with actually the vaccine or that immunobiological sample, like I said before. The whole process of vaccination, the vaccine, the adverse reaction, the severe adverse reaction, and the following pathology can have some long-term impact on the overall health of that individual. But if that adverse reaction doesn't happen, if that patient doesn't go into like an anaphylactic shock or something, I don't see any reason to have any long-term adverse reactions to the vaccine. Okay, anything about infection control in outpatient setting? Okay, I think uh, we can safely stop now. The next session will begin in nearly 10 minutes. So I would very much appreciate your patience in that regard. So stay tuned. We have more interesting things for you to come. Thank you. Yeah, so questions are still coming. There is a little bit of a lag in it. Somebody has asked, is the vaccine useful in already infected COVID? No, vaccine by its nature will not be useful in uh, active patients of that infection. We don't give vaccines to people who are already exposed to that infection. We only do that in case of rabies and tetanus. We give post-exposure vaccination, but generally vaccines are always pre-exposure. We do that before that patient is exposed to COVID-19. But again, the nature of vaccine has to be scrutinized. If the nature allows it, and if the resulting immunological memory is superior in case of vaccination than the natural infection, then probably. But like I said, the nature of vaccination has to be scrutinized. Uh, so is it control and infection for Lysol, Savlon disinfection? I think what you mean to ask is that can we kill the bacteria with Lysol and Savlon? COVID-19 virus, the SARS-CoV-2. With Lysol, yeah, absolutely. The Lysol will kill any type of viruses. Even Savlon, but I think it will be the contact time has to be a bit more, a bit longer. So actually, COVID-19, the SARS-CoV-2 virus or generally viruses are not that hard to kill with chemicals. Okay, I mean the viruses like the SARS-CoV-2, which have that typical envelope. They are not generally very hard to kill with chemicals or heat for that matter. Okay. Yes. So I guess we can wait for the next session now. Thank you.
हे चालूच ठेवा मला याला बंद करू नका. थांबा इकडून थांबा तुम्ही आता
Hello, sir. Welcome to our. Hello, sir. Can you hear me?
Hello. त्यांनी आपलं शेअर नाही केलं. काढून ठेवा. टेक्निकल मध्ये कोण थोडंफार असलं पाहिजे रे, हे लय आवश्यक आहे. हॅलो हॅलो.
नमस्कार सर, आवाज येतोय तुमचा?
सर नमस्कार नमस्कार.
नमस्कार सर. सेशनला सुरुवात करूयात सर. तुमचं पॉवर पॉइंट मी शेअर करतो.
येस सर. येस येस सर.
So first of all, I would like to introduce to the viewers our next esteemed speaker, Dr. Narayan Jadhav sir. He is HOD and a professor in Nidan department at Dhanvantari Ayurved Medical College, Udgir. We are very pleased to have you, sir. And our viewers will definitely gain from your input.
Hello.
Sir, you can start whenever you are ready.
Yes, yes, yes. Please share slide.
Yeah, I have shared it, sir. There is a little bit internet time lag. You will see it very soon.
Okay,
You will see it
okay,
in
no
few.
problem. Okay, 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 okay. Good afternoon, everybody. It's my pleasure to be here. First of all, thank you to the organizers, LBVK Medical College and Hospital, Latur. I am very much thankful to the organizing committee, respected principal, Dr. Murje sir, and organizing committee, Dr. Rahul Jadhav sir, and all the staff members of the Ayurvedic College. I would like to share the Ayurvedic approach, that is Pranvaha, Srotas, Nidan and Samprapti, with special reference to COVID-19. Next, please. Next, please. Here the introduction contents are anatomy, physiology, common etiological factors of Pranvaha Srotas, common symptomatology of Pranvaha Srotas, and common clinical features of Srotas Dusti, pathophysiology, Ayurvedic aspect and modern aspect, Etiological factors, prodromal signs, symptoms, symptomatology, pathogenesis and Kriya Kala, Ukshanupshaya, Updrava, Arist and Sadhya. And every patient should be treated by our Acharya told Rogamado Parikshayat Tatunantaram Aushadam. First of all, we have to diagnose the patient and treat accordingly. First of all, we have to. This is the only overview talk. We all know the anatomy and physiology of Pranvaha, our respiratory system. Next, please. This is the overview only. Next, please. Branching of bronchial tree. If you look into the picture, trachea, primary bronchi, secondary bronchi, tertiary bronchi, microscopic airways, terminal bronchioles, respiratory bronchioles, alveolar ducts, and alveolar sacs. Next, please. Physiology. We all know the physiology of respiratory system. There should be the external respiration and internal respiration. Respiration occurs in two phases. Next, please. Function, transport of the gases, transport of oxygen, and transport of carbon dioxide. We all know. Next, please. Functions of the respiratory system. Supply of oxygen and removal of carbon dioxide from body to regulate hydrogen ion concentration, to increase the arterial oxygen tension, and helps to regulate the body temperature. Next, please. This is the gases exchange. Next, please. Common sign and symptoms. Here is the common sign and symptoms of this Pranvaha Srotas or respiratory system. The breathlessness. I am not going into the detail. Next, please. Next, please. Hemoptysis, wheezing, pain in the chest. Next, please. Clinical examination. We know Darshana Sparshan Prasnihi Parikshitat Roginam. In the same way, here we can inspect the patient. First of all, observe the patient, examine hands, observe the respiratory rate, see the patient's form. The shape of the chest. We look into the chest, shape of the chest. Next, please. Palpation. Sparshan Parikshan. Movement of the Hello. Hello.
No, sir, we can hear you.
Hello. Okay, sir. Okay. Sorry. Sir. Another one, clinical examinations, wheezing and crackles. Wheezing seen in the COPD, asthma, laryngeal disease. Crackles. Crackles are short, explosive sounds, often described as a bubbling or clicking noises, which are seen in the bronchiectasis, pulmonary edema, and COPD disease. Next, please. A pleural rub. The pleural rub is a characteristic of pleural inflammation and usually occurs in association with pleuritic pain. The stethoscope rubbing over the hairy skin may produce sound resembling of the crackles. Here is a pleuritic pain. What we call it the parsmal is there, and it is seen in the pleurisy. Ronchi. Ronchi is a continuous musical sound generated by air bubbling past the airway, seen in COPD and bronchial asthma. Next, please. Investigate. These are the common investigations in the Pranvaha Srotas or respiratory system. CBC. We look into for the anemia or HB% or leukocytosis, polycythemia, leukocytosis, eosinophilia, ESR. Montauk's test for tuberculosis. Next, please. Next, please. Spirometry. Okay. Microscopic examination in bronchial cases and lung abscess. Next, please. Sputum examination and spirometry. Next, please. Imaging the lung and chest. The X-ray chest is an important extension of clinical examination. Large homogeneous opacity or cavity fluid level may be seen. These are seen in the lung cancer, tuberculosis, or bronchiectasis can be diagnosed by this imaging the lungs. CT scan, computerized tomography, CT scanning, X-ray are passed through the body at different angles. Now we are using the in COVID HRC, lung cancer, bronchial tumor, and lung disease. Next, please. Next, please. Ultrasound. Diaphragmatic tuberculosis and intrapulmonary abscesses. MRI. It is mainly used in the tumor and tuberculosis. Fibroscopic bronchoscopy is essential for many forms of respiratory diseases. Next, please. Next, please. Lung function test, spirometry and peak flowmetry, immunological test, skin sensitivity test, suspected allergen is introduced intradermally, and Montauk's hip test used in tuberculosis. Next, please. Diseases. These are the common diseases of respiratory system. We all know. Here, SARS. Next, please. Now, we are going towards the COVID. Here, towards the end of 2019, a novel coronavirus comes. Severe acute respiratory disease or SARS-CoV-2 was identified as the cause of cluster pneumonia in Wuhan, Hubei province of China. We all know. Spread rapidly to 13 countries, affecting more than 11.1 million people worldwide and caused 4.44 lakh deaths in. This is the data up to the July only 2020. It was designated as a global pandemic by WHO in March. The present pandemic of COVID-19 has brought the so-called human activity standstill and has forced the entire world to seek this. The epidemics have not been new to India because Ayurveda, being the forefront of healthcare system, has recorded its valuable experience of epidemics and termed as in Janapada Dhons, Charak Vimanstha, Maraka, Sutrastha, along with the model of Masurika Pacharya Madhava. These are the examples of epidemics in Ayurvedic science. Here we are collaborating with the Nija Jwara and Upsargic Roga to explain the pathogenesis of COVID-19 with modern correlation. It is vividly described their mechanism of causation, Nidan. Now, modern medicine perspective of COVID. Look into the picture. Here, if you look the picture, here main focus is on in the lungs, and this coronavirus is like as a cron. Here, this is the structure of the coronavirus. Here is the nucleocapsid, spike glycogen protein S, membrane proteinium, envelope E, RNA, hemagglutinin esterase dimer. This is the structure of coronavirus. Next, please. Epidemiology. The positive virus SARS coronavirus 2 has a zoonotic source closely related to bat origin. SARS-like coronavirus. It is an enveloped RNA beta coronavirus related to severe acute respiratory syndrome. And the virus has been shown to use the angiotensin converting enzyme ACE2 receptor for cell entry. The persons infected by the novel coronavirus are the main source of infection. Direct person-to-person transmission occurs through close contact, mostly in closed indoor spaces, mainly through respiratory droplets that are released when the infected person coughs, sneezes, or talks. These droplets may also land on surface where the virus remains viable. Infection can also occur if a person touches an infected surface, and then the median incubation period is 5.1, ranges 2 to 14 days. The precise interval during which an individual with COVID is infectious to uncertain. As the current evidence, the period of infectivity starts 2 days prior to the onset of symptom and lasts up to the 8 days. The virus has basic reproduction number. The extent and role played by preclinical asymptomatic infection transmission still remain under investigation. Clinical features include fever, cough, other respiratory symptoms, mild diarrhea, loss of taste, smell, and fatigue and dyspnea. Next, please. Here is the structure. Next, please. Virus properties. Influenza virus and SARS COVID virus. It is a four-strand virus. Multiple subtypes are in influenza virus. Here, single-strand virus, non-segmented RNA genome, spike S protein enveloped virus. Next, please. Here is the pathogenesis of virus. Here, SARS-CoV, entry of the SARS-CoV virus into the lung and in AC through gut, tissue damage, hyperinflammation, cytokine storm, antigen presentation, cellular immunity, and humoral immunity. Next, please. Here also the pathogenesis of this virus. Next, please. Pathogenesis and risk factors. Here, extensive overlap is here. Influenza, rhinovirus cases, whooping cough, atypical pneumonia. These are the risk factors. Symptoms of COVID-19. We all know all these the symptoms of COVID-19. Next, please. Here symptoms. Here is the differentiation between COVID, influenza, and common cold. Next, please. Clinical presentation of COVID-19. Asymptomatic infection. First of all, how we diagnose the asymptomatic patient? Absence of clinical signs and symptoms of the disease, a normal chest X-ray or CT scan associated with positive for SARS-CoV. Mild infection. Upper airway symptoms, fever, fatigue, myalgia, cough, sore throat, running up nose, sneezing. Pulmonary clinical exam is normal. Some cases may not have fever and others may experience gastrointestinal symptoms such as nausea, vomiting, abdominal pain, and diarrhea. A moderate infection. Clinical signs of pneumonia, persistent fever, initially dry cough, becomes productive, may have wheezing or crackles, and pulmonary auscultation but shows no respiratory distress. Some individuals may not have symptoms or clinical signs, but chest CT can reveal typical pulmonary region. Here, HRCT should be done. Severe infection. Initially, respiratory symptoms may be associated with GI symptoms, such as diarrhea. The clinical deterioration usually occurs in week with the development of dyspnea and hypoxemia. SpO2 is below the 94%. Critical infection. Patients can quickly deteriorate to acute respiratory distress. Here, distress should be here. Respiratory failure and may present shock, septic shock, kidney injury or heart failure, coagulopathy, or multiple organ dysfunction. Next, please. These are the multi-organ failure. This is the sign of multi-organ failure in this COVID-19. Next, please. Here, common symptoms, uncommon symptoms. Uncommon symptoms are headache, hemoptysis, diarrhea, confusion, rhinorrhea, chest pain, nausea and vomiting, sore throat and sneezing. Common symptoms we all know. Now, complications. Because first of all, I have congratulated the Ayurvedic College Latur because they are organizing the such type of seminar, and here is our role. Complication. Now patients are coming with post-COVID complications because there is a no treatment and vaccination also not possible at at, at today. So, acute respiratory distress syndrome, secondary infection, ventilator-associated pneumonia, septic shock, acute renal injury, hypoxemia. And these are the complications of COVID-19. These are the patients are coming towards the Ayurvedic physicians nationwide. Next, please. These are the complications related to the cardiology. First of all, here SARS-CoV invasion, inflammation, metabolic activity deranged, microvascular damage is here, coronary arteries blockage is here, endothelial cell also in dysfunction, acute coronary syndrome (ACS). It causes myocardial uh, infarction. Next, please. These are the this is the mechanism of pathophysiology of the different multi-system organ failure of the due to the COVID-19. Here, the direct cytotoxic effect, dysregulation of your renin-angiotensin system, endothelial cell damage and thromboinflammation, dysregulated immune response. Next, please. Here are the neurological complications of the this COVID-19 pathogenesis. If there is a pulmonary and systemic disease, it goes to the hyperinflammation, multi-organ failure, and hypercoagulative stress. It leads into the encephalopathy, stroke, direct invasion of the nervous system, vasculitis, stroke, encephalitis, muscular damage, insomnia, and dysgeusia. Insomnia, a post-infectious immune-mediated complication. Here, encephalitis, Guillain-Barré syndrome variants, and ANE and ADEME. Next, please. Now, pathophysiology of this COVID-19. Most patients with COVID-19 predominantly have mild respiratory tract infection associated with SARS virus 2. In a small proportion of cases, they can progress to a more severe and systemic disease characterized by the ARDS, sepsis, septic shock, multi-organ failure, including acute kidney injury and cardiac injury. There are some reports. Autopsy findings in China and European countries showed endothelial damage of pulmonary vasculature, microvascular thrombosis, and hemorrhage. This leads to the myocardial infarction or stroke or cerebrovascular accident. Extensive alveolar and interstitial inflammation that ultimately result in COVID-19. It causes vasculopathy, pulmonary intravascular coagulopathy, hypercoagulability or ventilation perfusion mismatch, and refractory ARDS, hypoxemia secondary to ARDS may also activate the coagulation cascade. Next, please. Here, no drug is to be curative. We all know, although several are being studied extensively. These are the some antiviral and some other drugs. Favipiravir, chloroquine, remdesivir, steroids like dexamethasone, and interleukin 6 inhibitors like tocilizumab and convulsions plasma therapy. Prevention encourages diligent hand washing, practice of respiratory hygiene, avoiding of touching face, cleaning and disinfecting of objects, frequently touched, ensuring adequate ventilation of indoor spaces, wearing of mask. These are the only and only options which we are. Next, please. Next, please. Now, the causation of pandemic as per the Ayurveda. Look into the Shastra. Here, one term is called is an adharma, activity contributing to the destruction of sustaining principles of life or nature, which include air, land, and water derived. We know dhareti dharmam, na dharmam adharmam. Adharma means धर्म धर्म का पालन नहीं करना, इसे अधर्म कहते हैं. Hence, in this context, adharma is deemed as all the activities contributing to destruction of air, water, and land. These are the man-made hazards. Here, disturbances of air currents. We all know. I am not going into the detail. Next, please. Disturbances to ecology of water bodies. Pollution of water bodies, sand mining from rivers bed, unregulated damming, contamination of ocean beds. Disturbances to the land ecology. We all know the pesticides, fertilizers, and rapid urbanization and huge constructional activity with non-eco-friendly material, overexploitation and destruction of mountains, forests, and ecosystems. Destruction of other life forms like animals, plants, birds. We all know biodiversity. Displacement from their natural habitats, uses of non-biodegradable toxic materials like plastic, pesticide, etc. Activities of this kind vitiate and disturb the balanced forces of nature and gives rise to the abnormal air currents, cyclones, floods, non-seasonal rains, extreme weather conditions. We all know there is the effect Pindi te Brahmandi. Each and every substance is made up of from Sarva Dravyam Panch Bhautikam. And we are the representative of this Panch Bhautikam. The destruction of Amazon wild, example is forest or destruction of Australian forest due to the wildfire. Extreme weathers, non-seasonal rains experienced around Europe, Australia, India can be taken as arista warnings of this. These are the warning signs of this type of pandemics. The vitiation of air currents, seasonal irregularities, and disturbances of land and water ecology simultaneously induces or leads to the vitiation of dosha, or cytokines in humans, causing mass susceptibility to the same illness, while also affecting the aushadhis also. Our acharyas have told these type of adharma is there, then the aushadhis of that bhumi are also ineffective. These reducing the nutritive value and leading to undernourishment. When this combines with the causative factors causing Agnimandya, that is the sluggishness of metabolism, it leads to infectious diseases like COVID-19. Probably more in future of if actions are not taken, maybe so many pandemics coming. The predominant pulmonary involvement of COVID-19 can be explained by the commonality of Pranvaha Srotas, visheshing factors. We all know the Kshayat, Sandharanat, Rokshat, Vyayamat, Shuditascha, Pranvahini, Dusyanti, Anyascha Srotasat, Darune. Here is the Kshay, it means a weight loss, Vega Sandharan, constipation, Rukshatva, low fat, high fiber diet intake, Vyayamat, Shuditascha, inappropriate excessive exercise and increasing incidence of disease in the present day of lifestyle. Next, please. Here is some flow diagram. Hello? Hello?
Hello, sir.
Hello?
Can you hear me, sir?
Hello? Ah, I'm audible?
Yes, sir.
Hello?
Yes, sir. You are audible, sir.
Okay. Now, we are going to Ayurvedic perspective of COVID-19. Here is a Janapada Donsha or Maraka. This Maraka is concept from Susruta and Apsargik Roga. Here, Upa means near, Sarga means produced due to the proximity of contagious disease. And following the model of pathophysiology, Samprapti explained by Acharya Madhava in smallpox should be taken as shares the factors of being the pandemic. Viral infection spreading through the respiratory route, highly contagious with COVID-19. Many authorities have suggested COVID to be accepted as a agantut jwara. Next, please. Reality, the difference lies in the fundamental difference is that defines approach to fever between modern medicine and Ayurveda. In modern medicine, has always looked for a cause from outside, basing itself on the germ hypothesis. The cause of the fever is, or infection is the germ hypothesis, while Ayurveda has always looked into inward and feels its dosha or nija that calls all these fevers. Ayurveda believes that even if there is a virus or bacteria, until there is a no vitiation of dosha, primarily in the body, none of can infect the human system in a way that it manifests as a disease. This fact is accepted by modern medicine in the context of tuberculosis only. That although there is an infection, disease can happen only if immunity is weakened, and in sepsis, which is deemed to happen, not due to an infection, but only when the host mounts a dysregulated immune response. Hence, we believe that although modern medicine may feel that COVID is caused by virus, from classical Ayurvedic perspective, it is completely acceptable. But it should be taken as a secondary, and primary importance should be given to the host factor or nija dosha or increase the mass susceptibility only in the manifestation of the disease. This is the fact that although same virus is causing, we all know when the same virus is causing so many people, but we are getting some patients are asymptomatic, some are mild symptoms, having mild symptoms, few have severe disease, which will feel strongly is due to the status of dosha in the cell. Particularly the asymptomatic infection highlights the concept of viral infection in a subject with dosha samya, and underlying the importance of dosic vitiation as the primary determinant of the disease manifestation, not just an infection. This is clearly described by Shatakiriya Kala. Sanchayam Prakupam Prashamam Cha Kana Samsaram Ekti Bhejascha. These are the six uh, pathogenesis stages of the described by our Ayurvedic Acharya, Sushrutacharya. Here, increased mortality in patients with comorbidity also suggests the role of dosic vitiation as the primary determinant of disease severity. So the vitiation of Vayu, Jala, Desha, Kala, and Ahara induce the formation of specific dosha in all, leading to mass predisposition or mass susceptibility of the disease. In the case of COVID-19, an imbalance of Vata and Kapha, the people indulging specifically in a Vata Kapha provoking RVR at Vata's extreme of age, elderly, or Vata's Kapha like hypertension, COPD, bronchial asthma, or Dhatu, or Ojaksha, immunocompromised. That is, these are the comorbid factors described by the modern medicine are found to have a more serious disease. Underlying dosic importance, hence we conclude the COVID-19 from an Ayurvedic perspective should be taken as a Nija Jwara and Upsargic Jwara. Next, please. Next, please. Hello?
Hello, sir.
Hello?
Hello.
Next, please, madam. Hello? Hello?
Hello, sir.
Hello?
Hello, sir.
Hello?
Please continue.
Next, please. हा ऐकतो मॅडम मी हा ऐकू येतं नेक्स्ट प्लीज हॅलो हॅलो
Hello, sir. Hello.
when we summarize this, when we going into the Nidan Panchaka our Shastra, here are Viprakrishta Nidan, Hetu, remote causative factor, is a Pradnya Pradha, Adharma, Dushit Vayu, Jal, Desha, Kala, Sannikrishta Nidana, proximate causative factor, Vatakapa Prakopak, Ahar, and Vihar. Vikruta Sthiti of Vata and Amar. Sorry. Manifestation of Vatas or Vat Kapha Jwara in Sama Avastha. It should be noted here that in the latter stage, after the development of Rasa Shastra, here concept of antibiotic is here, felt a strong resemblance in the pathophysiology of fever to the pathophysiology of Visha, and started use of poisonous plants or minerals Both are Sthavar Visha. Incidence of the modern medicine now diagnostic protocol for COVID-19. Here we know mild illness in which rhinitis, sore throat correlates with jvara, vatakappa jvara, and kapha jvara. Rarely each exists somehow nirama. Correlates with the same as mild illness, but in a pravruddha avastha due to increased roga bala, due to strong causative factor and decreased rogi bala, vata jvara, vata kapha jvara, and kapha jvara. Each of them can exist in somehow nirama avastha also. Here mala pravritti or atisara due to malagat or dhatugat mansal asthi jvara, charak chikitsa. Severe pneumonia, respiratory rate more than 24 per minute, SpO2 below 90% on room air. It corresponds to Vatalban Sannipata or Vata Kapolban Sannipata, Santata pattern mostly in Samavastha due to the strong or multiple causative etiology causing strong dosavitiation. Next, please. Next, please. ARDS, severe respiratory distress. Previous. Okay. It refers to mostly Vatolban Sannipata, sometimes Vatakapolban Sannipata, with Pravruddha Swasa or predominance of dyspnea due to the Sama Rasa Rakta Dhatu, which increased the Pichila Guna, adhesiveness of the ama, leading to Srotoroda, obstruction due to the micro and macrovascular thrombosis. Sepsis, fever, tachypnea, hypotension, altered sensory. It also refers to Sannipat Avastha Abujwara with features of Pipasa, Mukhashosha, hypotension, tachypnea, swas, altered sensorium, pralapa, tandra, representing the antarvega avastha. Septic shock or refers to sarva sama sannipata avastha with progressive dhatupaka, that is the tissue necrosis or tissue destruction, Srotoroda, and finally Agnikshaya, metabolic failure. The various features described can be correlated as follows. Next, please. Next, please. Here, altered sensorium. These are the correlates of the Tandra, Moha, Pralepa. Respiratory distress, Kasa Swasa, Kanta Kunjana. Hypotension, Brahma Troshna. Coagulopathy, Stivam, Raktam Pittasya, bleeding, clotting. Kotham, Syavam, Arunam, Mandalam Cha Darshanam Cha. Alkaptonuria, Alkurian anuria, Chirat Mutra Darshata, Alpasya, GI dysfunction, Krutva, Udarashcha, Udara Gaurav. Any of the above features, along with manifestation of ama, leads to sama avastha in most viewers due to the reduced agni in amasya, upper GI or liver. Rasadhatu is partially digested and produces an intermediate product called as ama, having guru, visra, atipichila guna, leading to srotoroda. Sama can be deemed to be the chief source of inflammatory cytokines or the food for the viruses and bacteria, and the source of active immunity leads to chronic state. Next, please. Next, please. Here, if the disease is produced by multiple acts of omission or commission or causes, Hitu Bir, Bahubira Jato, Sita Ruksha Ahara, and Upwasa, leading to strong dosha, high causative cytokine load, which is visible by multiplicity of symptoms or involvement of multiple systems, and if associated with mandagni, inefficient metabolic clearance, jora is severe and it can be fatal. Second is when there is a concordance of four factors, that is the dosha, dushya, prakriti, and kala. The resultant fever is severe and continuous and called as an santata jvar. It follows a different and more aggressive course. Next, please. When we go into the historical background of our historical fact, that all epidemics in India have been more severe in the Varsha Rutu, June to November. For example, a plague epidemic in 1897, a Spanish flu in 1918, swine flu of 2009. These are into the Varsha Rutu. Due to the concordance of these above four, these three dosha also rapidly initiate from the very beginning all the seven dhatus and two mala. That is the dvadas ashraya in Jadhav produces all the srodasa and hence produces a continuous dosha. Rapid Dhatupaka can be seen and correlated by following. Here, Dhatupaka is measured by the investigations are here. Elevated inflammatory markers, CRP, serum ferritin, AMA. We can diagnose it in the presence of AMA. Elevated D dimer, LDH, SGOT, SGPT, prothrombin time goes into the Rasa Dhatu and Rakta Dhatupaka. Elevated CPK and troponin, Mouse Dhatupaka. Lymphopenia, mouse Majjagata Paka. Elevated serum creatinine is a Malap Paka. If fever happens in debilitated patient, the state of mind and strength of mind, manas, along with the actions or lifestyle followed by the subject karma, will also determine the severity and outcome of the disease. Example is the anxiety, depression, and karma worsen the outcome. Now, understanding of ARDS COVID-19. The ARDS attracted worldwide attention due to its peculiar pathophysiology of microvascular thrombosis to frank thromboembolism. According to Ayurveda, this reflects an increase in stickness, that is the pichil guna for ama, mostly due to the ama, rather than kapha, which along with vata dosha leads to srotoroda. This also correlates with the high titers of inflammatory markers, that is the serum ferritin and CRP, which are usually associated with amavastha or pitta dosha. Hence, necessitating the use of katurasa for its shonit sangata bhinati, thrombolytic action and amapatha. Next, please. Next, please. Here, Divaswapa, daytime sleep, snana, prolonged bathing, abhyanga, massage, or applying oil, krodha, anger, vyayam, exercise, ahar, guru ahar, atimatra ahar, vruddha. These actions prolong or intensify or complicate fever and hence are to be avoided, particularly during first 7 days of fever. This should be avoided. Limitations in the COVID-19. Reverse and reaction. It is highly computerized tomography, fragment protein, CRP, CRP, and these are the common diagnostic tests of this COVID-19. Now, here when we treat the patient accordingly, say because regular prevention. Players in prevention aims the reverse of the Vakadosha, Sanipata, Abhati, Chakati, these are the main points. At the root cause of epidemics is rural copa. People realize the meaning of life and learn to live in harmony.
Hello? Hello, sir? Excuse me. तीन वाले
Hello.
हेलो सर हाँ सर सर कैन यू ऑडियो
All these are the measures. With the help of this, we can see another provider. Next, please. Hello.
हेलो सर हेलो हेलो सर आवाज येतो सर
Stop sharing.
ओके थैंक यू सर
Hello.
हेलो सर आवाज येतो सर
Hello.
हा सर आवाज येतोय तुमचा
Hello.
कंक्लूड करू प्रॉब्लेम
Hello.
हेलो सर आवाज येतोय
Hello. Hello. Hello.
सर तुमचा आवाज येतोय तुम्ही बोलू करा
Hello.
हेलो सर सर बोला सर तुम्ही हेलो
Hello. Hello.
हेलो सर सर तुम्ही बोला सर सर आवाज येतोय सर आवाज येतोय
हाँ
सर
थोड़ा येतोय मॅडम हाँ स्क्रीन शेअर होत का
सर शेवटची स्लाइड होती ती हेलो सर सर नेटवर्क प्रॉब्लेम येतो
ओके नो
शेवट
प्रॉब्लेम ओके नो प्रॉब्लेम आवाज येतो ना ओके
हाँ सर मी कन्क्लूड करू सर सर रिमूव्ह झाले Device not connected.
आयुर्वेदा
Okay, so we have some questions, sir. This is
आयुर्वेद अवतरण लिंग औषध ज्ञान स्वस्तात परायण लिंग औषध ज्ञान when we this pandemic, we go to Udgir only to second thing is
Hello, sir. Hello, sir. Sir, can you hear me, sir? Hello, sir.
hello.
Sir, we have one question,
Hello.
sir. Hello.
Hello.
Hello, sir. Sir, we have some questions.
Yes, ma'am. Yes.
This question
Yes.
from Dr. Rahul Jadhav, sir. The question is, can
Yes.
COVID-19 virus infect other body tissues, sir? Can you tell us?
First of all, the entry of the virus is through nasal route. After that, it enters into the bloodstream and body tissue also. Hello.
Hello, sir. Sir, sir, hear
Hello.
me? Can you hear me, sir? Hello.
Yes.
Okay, sir. You can hear, sir.
Hello.
Hello. हाँ sir, continue
Hello.
करा sir.
Madam.
Hello.
Yes. Yes. We are knowing here the basic सिद्धांत निदान शिक्षितः क्रिया योगे निदान परिवर्तन. If look into this matter, the adharma or pragya we practices the dharma, then there is no problem of this adharma. Sankshiptaha kriya yoga nidan parivarjanam. Each and every disease should be treated by this only, because we are COVID-19 have no treatment. We all know, but this sentence of this our shastra, Sankshiptaha kriya yoga nidan parivarjanam. If we all the measures of, it may be social distancing, it may be lockdown, it may be we are going through these practices are comes under this nidan, nidan parivarjana. Second thing is samprapti vightanameva chikitsa. When we look into this concept of this condition, then we can treat accordingly or symptomatically by our shastra. Second thing is, now patients are coming with post-COVID complications. Post-COVID complications are very well we can treat by our basic principles. Hello.
Okay, sir.
Hello.
Okay, sir. Thank you. Okay, sir. Sir, we have one another question, sir. Hello. Sir, another question is.
Yes, ma'am. Yes, ma'am.
Sir, can you tell us about HRCT in COVID-19 infection?
Hello, madam. Yes.
Yes, sir.
Question का?
Sir, can you sir
Tell
HRCT
about HRCT in COVID-19.
Yes, sir.
Yes. HRCT बद्दल काय सांगायचं? Hello.
Okay, sir. Sir, time खूप होतं. We are going to conclude this session, sir. Hello.
HRCT बद्दल काय सांगायचं? HRCT is the high resolution computerized tomography. It diagnosed interstitial lung disease, pulmonary fibrosis, bronchiectasis,
Okay, okay,
HRC.
sir. Okay,
Ah,
sir. We are going to conclude this session. Thank you very much,
okay,
sir, for your
thank you, all
valuable
of you.
time.
And I would like to say very much sorry because there are
No,
so many technical problems during this presentation. So I am very much sorry, and thank you all of you. And thank you, organizing committee, and all the learned people who are taking part in this webinar. Thank you very much.
no, sir. Our wait was worth it, sir. No problem. You give
Yes,
us
ma'am.
a very valuable time, sir. Thank you very much. You concluded this session. Also, I want to thanks for Dr. Rahul Jadhav, sir, who conducted previous lecture. And we are now going to conclude for next session. Our next session is concluded by Dr. Kore, sir. Dr. Naresh Kore, sir. Okay.
Next session will be. Thank you very much again, sir. The next session will begin in roughly 10 to 15 minutes. Please stay tuned. And we will start the session very soon on this time. Thank you very much, sir.
शेअर होत होतं. सरांना कोरे सरांना करू.
Yes.
बाहेर सर कोरे सरांना पाठवते. हॅलो.
हॅलो राहुल सर,
आवाज येतोय?
क्लिअर आहे?
हो सर, क्लिअर आहे आवाज.
पीपीटी शेअर करताय तुम्ही? कमी करू शेअर? मला शेअर करायला अडचण आहे, तुम्ही शेअर करा.
शुअर शुअर सर, मी तुमची पीपीटी शेअर करतो. तुम्ही जेव्हा म्हणाल तेव्हा आपण सुरुवात करूयात. कॅन वी बिगिन राईट नाव? हॅलो सर. नाही नाही, ते युट्यूब वर दिसायला लागले. Okay, it will take a minute for a choreographer to join the session. It seems to be a network problem. Anyhow, yes, you are back, sir. Can you hear me now? Hello, sir. Sir, it looks like you are back in the network. Can you hear me now?
Now I am. Hello, Rahul sir. Hello. Hi. Yes, Rahul sir. आवाज येत नाहीये का राहुल सर? हॅलो.
Welcome back, sir.
Yes, sir. Now, audible?
आता येतोय सर, एकदम व्यवस्थित आवाज येतोय. Can we
एकदम
begin the
व्यवस्थित आवाज
session?
येतो. एअरफोन लावून टेस्ट करतो. एअरफोन कसा आवाज येतो ते मला सांगा. ओके, now I'm good with earphone. अभी क्लियरिटी कैसे है? पहले अच्छी है कि ये अच्छी थी?
नहीं, आता ठीक है सर. It's very clear and loud.
Yes, very good. Now you can start the presentation.
So viewers, welcome back to the another session. For this session, we have Dr. Naresh Koresar. It's a very dear friend of mine, former colleague. He's currently professor in the Department of Kaya Chikitsa, School of Ayurveda, Rahul University at Gujarat. And we are very fortunate to have him. He is one of the people who have worked on the front line and worked with the patients of COVID-19. So his input, I think, will definitely be very valuable to the viewers. And again, I will have to apologize for the technical delay to the viewers, but I can assure you that your wait will be worth it. So we are back with again amazing session. So we can begin anytime Koresar is ready. Will I start the PPT, sir?
Yes. Can I start, Rahul?
Yeah, sure, sir. You can start.
Yes. Thank you, Dr. Rahul Pallavi. Good afternoon, principals, administrative officers, sir. Respected all my faculties, the viewers, and my dear and dear friends. Thank you very much for giving the opportunity to communicate with you on this dais. All time I feel very much energetic when I suppose to be a part of LBVK Medical College and Hospital campus. Definitely, whatever the things I have collected from the campus, just now, there has any need to implant or to idea about the new. So thank you much again. Thank you, Dr. So because reading of the time slot. So we start the presentation. Next slide, please. Slide. Next slide, sir. The point of discussion for this today's webinar is a critical analysis of Ayurvedic treatment protocols for COVID-19. Now it has become a history. All these things starts in December 19, just 1 year before. And at that time, the presentation of some clinical syndrome been found in one part of the world. Everyone was getting amazed by that typical clinical presentation. And when it passes, then COVID warriors who are actually working for treatment of the patient, the COVID-19. So they have provided a very valuable data regarding the etiological factors, the pathogenesis, the clinical presentation, the prognosis pattern, investigation pattern, and some kind of treatment protocols. Then, so nowadays, I think a lot of information has been collected by us, even though the common people are also get unaware about the information about the COVID-19. A number of myths there when I was there in the society meeting with the patients and related to the patient. So एकदम कॉलर टाइट करके उसके ऊपर कोविड में बातें कर रहे हैं भैया feel so we better know what is the exact reasons and all. So world is better the vaccines and a definite protocol for the COVID-19. So in this session we will discuss regarding the Ayurvedic protocols. So just already I have started. Hello, there is anyone?
Yes, sir, we can hear you.
Rahul sir, problem?
नाही सर, ऐकू येतोय आवाज, तुम्ही बोलत राहा.
Dr. Rahul, any problem?
No problem, sir.
Dr. Rahul sir?
You can hear me, sir.
From the audience, just they can comment or they can comment on the box whether I am audible properly or not.
Yes, sir, you are audible, sir. You can continue.
Yes, yes. Okay, thank you. Because so the journey has been started. Yes, yes, yes. The journey has been started 2019, and the modern science continuously updating their protocols. Came by WHO, then for AIMS, Delhi, then ICMR. Yes, 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 yes. So various protocols, and continuously they are updating their protocols. The same thing also happened with our Ayurveda. I think in the May, April, the government has given mission for the Ayush practitioner for the treatment of COVID-19. And first phase has been started in Kerala, because the Kerala government has first government authority who has given permission to the Ayush practitioner. So government of Kerala is the first government authority who has given permission for treatment of the COVID-19. So the first protocol which come towards me of Prayal Mahadevan is a magician of Tamil Nadu. Protocols, a lot of people have been get benefited by protocols. And at other state, the Kerala, even the Gujarat government also, they allow Ayush practice for active management of COVID-19. And department some guidelines regarding the COVID, that is turmeric and milk, Ayush card, and yoga sanas and all everything. By Patanjali protocol or protocol for the disease condition of the COVID-19. Afterward, on demand of the people, allopathies also publish their own protocol. So after analyzing all these protocols and various theology, just like when we are studying then when we are a specific disease, for example, Pandu. So we already got a lot of confusion. Sushruta and Bhagat, Madhav, Nidan, everyone is having little diversity of opinion, etiology, lakshanas, samprapti, and all that. And if you discuss about the treatment protocol of fusion, now various school of thoughts are there parallelly here in the Ayurveda, and they are producing various type of treatment protocols also. So, but being as a practitioner, keeping all this confusion aside, I had to treat the patient. So, after doing a critical analysis and whatever the school of thoughts, personally I follow the school of thought literature, it's classical literature. So, I have analyzed all these protocols, and whatever the positive points I got from that protocol, I can derive that these are the negative points in that protocol. Very recently, I got protocol of COVID task force of Maharashtra. So every protocol is run on that particular time. But for the implementation purpose, I have made some changes. Whatever the positive things are there, and evidence-based things are there. So I pick up from that protocols and summarize some slides which I want to present in front of you. Rahul sir, please, previous slide. Previous slide, please. Yes. So just I attended the previous two sessions also. Dr. Jadhav sir, Dr. Rahul Jadhav sir, he has given a very nice presentation regarding the present scenario of the prevention of the COVID-19. And the Dr. Narayan Jadhav sir, he has enlightened very beautifully the topic of etiological factors and pathogenesis of COVID-19. Okay, he's explained from that Nidan Panchakarma and Nidan Road Nidan field. So, whatever I just declared before 2 minutes, that I have collected some points which I feel very important for the diagnosis of the patient, for the treatment of the patient, and for defining the prognosis of the patient. So, whatever the protocols I got, so from that, the principle base or approach I got according to the Ayurvedic principles, I found these 6 categories. First, some call they are Vyadhi, some protocol they are Agantuja, specifically Bhuta Vishangai. Some protocol they are based upon the Krumi, that is Raktaj Krumi. Some people they approach COVID-19 in the so some protocols I got from Kerala. So they emphasize COVID-19 regarding the Vishavya and Visha Chikitsa, that is Agada Chikitsa. And even though Rajakshma, which is a Mahagata, that Rajakshma also, some disease protocols are according to the Rajakshma. So these are the probable Sampraptis that I found important for the diagnosis of COVID-19 syndrome. I call it a because system involvement is there. Till we are updating the clinical pattern, till we are updating the pathology of that. So these are the 5 important factors. Specifically, what I empathize on the Agantuja Jwara. So when you talk the Agantuja Bhuta Vishangaj, not talk about the Bhuta Vishangaj and all everything that Devapatra Chikitsa. So evidence based, whatever the evidence is there. So in the modern science already declared that the virus is responsible for this pathogen. So ultimately virus are not part, they are external. So we can label it as Agantuja Hetu. And this Agantuj Hetu having a potency to produce disease inside our body. So while describing your topic, Dija and Agantu, these specific 2 types has been explained. So this COVID-19 has been categorized in the Agantuja Jwara. So Agantuja Jwara and the Nija Jwara is different than the pathophysiology and in the presentation also. So here in a Nija Jwara, then Mityahar Vihar, whatever the factors and other factors are, they are directly responsible for causing the pathogenesis and dosha protocol. But here Agantuja Hetu, whatever the virus, bacteria, or yeast, so they get entered inside the body, the vitiate causes dosha protocol. So here little bit importance of the Agni Bandha. That Amanirmiti Agni Bandha. That is possible with the something of a Nija dosha. So by the way, if you consider this COVID-19 as a disease and Agantuj Hetu, so it is perfectly able into Hetu that causes direct dosha protocol. So this dosha protocol have to reside into dhatu, simple classical, simple staging of the according to Ayurveda. First, the Hetu, that is Ankush Hetu, it causes dosha prokop causes the vitiation of Rasadhatu. Rasadhatu vitiation itself causes the vitiation of Rakta, Mausdhatu, and further up to the Oj. So whatever the Samprapti is there, it will be of this particular track. So the Agantuja Hetu, Dosha Prokop, Arthadhatu Vishesham, and Panchakarma. So these are the 4 important pathological events which we have to take care by defining the protocols. So next slide. Sorry, before. Tike, yes, slide. So if you go for the modern pathophysiology, they have categorized three particular stages: pre-disease stage, disease stage, and post-disease stage. So, stage after incubation, whatever the pathology explained to Narayan sir, has get attached endothelium wall, and that produces toxic. Lot of inflammatory factors has been released, and the production of the various clinical symptoms. So here, in this pre-disease condition, already Hetu Sansarg has been done, and then afterward, initiation of Panchakarma is there. So we have to take care. So most of the patient, so they are reading the history, they got the communication, or they got the contamination. Sorry, they got the communication with the individual who is diagnosed as a COVID-19 positive, but till he has not produced any symptoms. So in this particular condition, we have to take care of Panchakarma. So here for this Panchakarma protection, that Shadam, this is the first curve has been explained in Charaka Samhita Chikitsa Shadam Gadaka, and the preparation method everyone is familiar with that. So this particular Shadaka, it will produce, at least it will take care of Panchakarma as well as Rasadhatu also. Along with Shadam Gadaka, we used to give the Tarpan, so Tarpan, Lajamanda, Arjun Manta, and a Mouse. So in Kerala, when I was discussing patients of Kerala, so the patient has given history of exposure to the COVID positive patient, but doesn't have any symptom. They have kept only protocol, that is Shadam Dodaka and Pan only. These people are quarantined, and after making the quarantine, the diet schedule has been matched, and only Shadam Dodaka and Tarpan has been provided to that patient. And the results were energetic. Most of the patient they never convert into the second stage of the disease. Next slide. Disease condition: asymptomatic positive patients, mild symptoms, moderate symptoms, and severe symptoms. Next slide. First, asymptomatic stage, no symptoms, absolutely no symptoms, no running nose, nothing, but the reports positive. So here we have to take care of Agdivardhan, Jwadhar Chikitsa, or Dosha Janika Chikitsa. So here multiple options are there. Chadi Kashayam, Drakshadi Kashayam, Patatra Kashayam, Shadadharan Churna, Talisa Patakam. Guruchadi Kashaya has explained, Drakshadi Kashaya, Guruchadi Kashaya, both has been explained in Ashtanga Uday. Amritatra Kashaya is from Sahasra Yoga. Shadadharan Churna and Talisadi Vatakam we are regularly using this. So all this, depending on the condition of the patient, Agni, Prakriti and all, we can choose any one of these. Is having a very fantastic role for this management of every stage of the COVID-19. Guru Chadi Kashaya specifically. It has been explained in Ashtanga Hridaya Jwara Prakarana. Daha Prashamana Gana is there, Guru Chadi Gana. So, Guru Chadi Kashaya and Dashmuru Katutrayadi Kashaya, these two medicines we can introduce at any stage of the patient, any stage of the disease. Even though one of my friend, Dr. Pankaj, he has produced a data of 20 patients of mild to moderate severe COVID-19 patient add-on therapy, the modern protocol or standard care protocol. Along with this, the Shri Kashai and Guru Kashai, he has introduced 120 patients, and very recently he has published his data in international research journals. So evidence are there. The Dashmu Kashai and Guru Chadi. So what are the symptoms? In previous slide, we taken care of a symptomatic patient. Now, mild to moderate symptoms: fever, cough, shortness of the breath, fatigue, muscle ache, headache, loss of taste, smell, sore throat, congestion and the runny nose and vomiting and diarrhea. These are some symptoms which are indicating mild symptom to moderate symptom. If breathlessness or dyspnea, air hunger is more, and fever is not in control, so that we can label the moderate to severe. Next slide. Next slide. So now disease 2, that is mild symptom. Here the treatment protocol. So here specifically the vitiation of dhatu, that is I have already explained that. Agantuj hetu, then amashaya, vitiation of Panchakarma causes Agnimandya, and vitiation of Rasadhatu. So here, when vitiation of Rasadhatu is there, so this particular produces, this pathology produces mild symptoms in the patient. So here we have to take care the sthana, that is Rasadhatu, even though Amashaya, Panchakarma, and we take care of Agni also. The previous slide, please. Previous slide. Previous slide. Yes. Yes. Next slide. So in this particular stage of the disease, positive reports are there having. So specifically, just already I explained Dashmu Katutradi Kashai, Elakanadi Kashai, and Tribon Plus. So Dashmu Katutradi Kashai and Elakanadi Kashai, both has been routinely practiced in South India in Maharashtra. So Dashamu Katutradi Kashai contains Dashamula, Katu, and Vasa. So ultimately, this combination is a good combination which will take care of the primary Samprapti within secondary Samprapti also. So Dashmu Patitradi Kashaya, when a piece of infection is there, the involved respiratory tract infection is there, upper respiratory tract is there, then just we have to apply the Dashmu Patitradi Kashaya. When running nose is there, position in there is then Ela Kanadi Kashaya. So ultimately, both and Katurasa is having all this, Katurasa is having fancy to take care of Urdu Jaturgata Vikram. Plus, Elakanadi Kasha is a lot of Gandhavya, stimulate the olfactory sense in nose. The patient is complaining regarding lack of smell and lack of taste. So ultimately, it will act on that. Katurasa in this medicine, which will be more effective in the treatment of the upper respiratory Jaturgata Vikram. So Tribhuvan Kirti is also a class medicine which is routinely practiced throughout the Maharashtra also. This Tribhuvan Kirti, Kapha Vatanu Bharu Avastha. When Kapha dosha are more, in that condition, one gets treatment protocol of the Vata when using and dry cough is there. So here we have to take care of the Vasha. So Balajiraka Dikasha, Nayopayam Kasha, Kasha, Sadikasha. So Nayopayam Kasha, which is having potency to relieve the aura of caffeine. So it is having the action both on Vata and Kapha also. So Balajiraka Nayopayam Vagra, Sadisada Churma, better option for Vata Kapano. Next slide. Third protocol there. First related with the Tarpan and Shadamgodana. Second protocol Bandi. Third protocol Vatanubandi. Fourth one is a Pittanubandi. If the symptoms of Jwara, nausea and vomiting are there, so which are indicating the involvement of Pitta dosha. So here, Tikta Kashaya, Patala Kotoranyadi Kashaya, Limbadi Kashaya, Kashaya. So all these Kashaya are effective according to the condition of the patient, even though according to the investigation. In coming slide, I will also enlighten the investigation patient with these all protocols. Next slide. Next slide, please. Now, the patient will discuss regarding the moderate to severe symptoms of the patient. Here, by means of this slide or by means of this information, so we have to categorize the patient in level 1, level 2, level 3, level 4, and level 5. In level 1, lipopenia found, lipopenia and thrombocytopenia. In level 2, raised D-dimer and troponin. In level 3, raised liver enzyme that In level 4, raise lactate kinase and myoglobin. And in level 5, raise create, creatinine and urea. So this particular level has been observed by defining the prognosis of the patient. If the patient is in level 1 and 2 and 3 also, then these particular conditions are treatable. But when patient moves 4 and 5, so ultimately the condition has been become critical. So we can explain or we can elaborate this particular condition in Ayurvedic terminology. So as per the prior discussion, we have Samprapti, Agantuj Hetu, Amash Agnimandya, Rasdhatu Dushti. So here we have to consider you better the malabhag of rasa is a kapha. So ultimately, when rasa dhatu get initiated, then kapha will be produced in a more quantity, and this particular kapha is responsible for involvement of the pranava srotas, that whatever the respiratory symptoms we are getting. So that particular part is important. This malabhaga kapha will be increased in more quantity. Even though the pranava srotas is having a moolasthana in amasha, so amasha is better, like rasadhatu mala kapha will be less. So this particular thing will cause the involvement of pranava srotas. In COVID-19 patients also, the patient who land into the severe cases, so involvement of the respiratory system will be more. So that is the one cause. So here, this condition, when the pathology accelerate in the Rakta Dhatu, so ultimately that cause increase in the bilirubin and LPT level. When Rapti land into Mausa Dhatu, that will cause accelerate into cause increase in creatinine level. And again to the Asthi Macha Dhatu, Shukra Dhatu, and OH. So here the two concepts are there. Describing the Sannipat Ajvala. So Acharya has explained two particular path in this Samprapti. The first path is a dosha path and second path is a dhatu path. When dosha path is there, that is good for the patient and which indicate the good prognosis. When dhatu path is there, so ultimately it indicates the critical stage of the disease. So we have two protocols or we have to select a drug which will initiate the samprapti toward the dosha paka, not toward the dhatu paka. The cytokine strong in that particular condition which will lead to the toxemia that we can correlate with the dhatu paka. So dosha paka condition here in previous slide, so we have considered that condition in the previous slide dosha paka. So if you take care of the Pachak, if you take care of the Rasadhatu, then ultimately it will not progress into the severe degree of the disease itself. The symptoms will be and patient will be treated by this of this. If something in the Dhatu Pak Avastha, then it will become a crucial stage for us. So here, please, previous slide, please. Previous slide, please. So here, when we feel that the oxygen saturation is decreasing, fever is not increasing, and other symptoms are also increasing, that we can label as a dhatu paka. So here, in previous slide, I have explained the levels of prognosis: level 1, level 2, level 3, level 4, and level 5. So here, when rasadhatu is initiated, then ultimately we will find neutropenia and lymphopenia. So in this condition, Indukanta Kashaya, Vasa Guruchari, Guruchari Kashaya has been explained, Pandu of Charita and even in Albert Sita also. So this Vasa Guruchari Kashaya is having a fantastic role for the Rasa and Rakta both also. In Indukant Kashaya has been explained in Rajakshman. Leukopenia or lymphopenia and neutropenia condition is there. So Indukant Kashaya take care of that condition. So in Dhatu vitiation, we found in the investigation of sport lymphopenia, start with the Indukant Kashaya or Vasa Kashaya, or both we can start simultaneously. Here, there is a role of some Vasa also there. If the Samprapti accelerated the that is DIC, disseminated intravascular coagulopathy. When the platelet count is reducing, then here you can start the Vasa growth along with these two kasha. If the Samprapti acts like dhatu, then ultimately Samprapti of Kama. Talan Nisevate, Tasam Asruga Mamsam Buddha Rokai Kalpati. Asrams, that is Rakta and Mouth, they get in the Samprapti. Here we will find in the infection, hyperbilirubinemia, increased D-dimer, and thrombocytopenia. So thrombocytopenia that can cause a bleeding, even though D-dimer is a marker, and hyperbilirubinemia, which indicating the involvement of the liver. So ultimately, in this condition, we have to take help of Vasakuchadi Kashai, Drakshadi Kashai, or Udhanavadi Kashai. All this has been explained in Stang Hruday. So here Drakshadi Kashai is specifically indicated, which is effective for the Visdesh Pitta dominant dosha. So here, Kuchadi Kashai, Drakshadi Kashai, and Punarnavadi Kashai, the condition, we can choose any of these two. Here, I will not recommend any type of Gruta because in Kamala condition and in severe Pandu conditions, it has been a contraindication of a Gruta Kalpana is there. Moves towards the Mons Dhatu. Simultaneously, we are getting in the distribution increased lactate and creatinine kinase. So here, Nivadi Kashai, Patolo Patolo Kashayam, Palasha and Kukila Kashai. All this Kashai has been explained in Hruday and Sahasrara. So here, take the group Shatavariyadi Kashai also we can add in the treatment protocol. Next. So Medadhatu. So here I concentrate on the Medadhatu. So Brakka involvement, that is increased serum creatinine level and urea. So here I recommend Varnadi Kashayam, Bhratyadi Kashayam, Tranapalu Kashayam, Dashmul Kashayam, and even Shadhanadi Kashayam. So depending on serum creatinine level, the serum creatinine level it's indicate the involvement of the kidneys and in what way the kidneys performing function in that condition. So we can choose whatever the kashaya it is. So here, so we can choose according to the creatinine level. If creatinine level is 2 is there, then we have to go for this particular Brahatyadi Kashaya. More creatinine is there, then Varanadi Kashaya, then Trinapanchamu Kashaya, Dashmu Kashaya. So after analysis of the patient and the report, the serum creatinine level, categorize this particular medicine in that condition. So some of the medicine that is Veeratarvadi Kashaya, that Veeratarvadi Kashaya explained in Mutraghat Adi. So Veeratarvadi Kashaya, Varanadi Kashaya, Brahatyadi Kashaya, Dashmu Kashaya, depending upon the clinical condition and investigation profile, you have to choose particular Kashaya. Here, Varnadi Vrita and Shatavarya Vrita, they are also, the patient is mild to moderate form, but lack of taste is there, but we can introduce a quantity, or I think the particular Sneha, which has been explained in a Mutra Vegadhara Vikar. So this particular introduced by means of Sneha or Outpatient. Now the Madhyadhatu involvement, a little bit altered consciousness of the CNS involvement is there. So here Kalyanaka Gurta, Mahakalyana Gurta, and Panchakarma Gurta get used. When OJS is involved, ultimately patient is unconscious, oxygen saturation drop, very less chances are there. Jivantyadi Kashaya, Shatabaki Vala Tele, Shatapaki Dhanam Tele, and Shirbala Grutam, Shatapala Grutam. So maybe this particular regime will be effective. Next slide. Okay. Now, so our reach up to the OJA. So here, if all these categories of people has been treated mildly, moderately, or severely, if portion park will be there, so that patient will land into recovery phase. So here, post-disease protocol. So post-disease protocols empathize in 3 clinical conditions. One, Jwara condition. Second, Punaravartaka Jwara condition. And the third reference from Grahani Adhyaya. In Grani Chikisadhyaya, Vyadhi Mandagno, the Agni has been initiated by the effect of the disease, Vyadhi Pashchata Mandagni. So in that condition, fortunately, while treating these three various conditions also, so only one regime on media has been advised or literature, that is Agrutopan. For treatment of the Jirnajwara, Sarpipana, Sarpipana, and Vyadhi Paschat Mandagno, again Sarpipana. So here, as compared to other Rasan Dravyas, I think Gruta Kalpana is most so medicated Gurutva, like the people Vidar is also having a good role. So here the challenges to now remission. Less data is available about the remission of the patient, remission of the condition. Second, post-COVID lung fibrosis. So for the treatment of the post-COVID lung fibrosis, I think Kalpana is a better option for us. And Vidaryadi Gurutva, Pipale group, and Vasadi group, these Gurutva are quite effective for the treatment condition. Kirata Kashai, which has been explained in Charaka Samhita, which is indicated for Purvajwara. So here, for the cases, avoidance of revision cases, or whatever, this Samprapti Ghatak has been remained in the body, which is supposed to be dormant and can cause a seed for the further pathology, we can take care by this discovery. Now, this is the last stage presentation. So very recently, we have made a protocols according to the clinical condition. Definitely, I have to I'm thankful to Dr. Ganesh Malvade. So he has helped a lot by defining or designing this particular protocol. According to CT scan score, now the common patients are also talking about the CT scan score. He asked, is COVID positive? Scan kiya, score. So people are telling that yes, that score, tera score, whatever score is there. So people also got an education about the CT scan score. So depending upon CT scan score, even though we can detect the prognosis pattern of the disease also. So here I have made 6 stages according to the CT scan score. Stage 1, rapid test positive but RT-PCR negative, patient is asymptomatic. Second stage, cough, but this diagram is normal. Third stage, CT scan up to 5, then 10, up to 15, and more than 50. Okay. Next. So when this in the stage 1, so the that is the rapid antigen test is, but the throat swab, that is RT-PCR, it is negative. So we can consider that the Sthana Samshraya in the NASA only. So NASA and Gala involvement is there. Then Katurasa Pradhan Dravya. As a slide, that while treatment of the Urdu Jatrugata, Katurasa Pradhan Aushadhi should be employed. So in accordance with this, so I have defined this all here in the Kashayam, Elakanadi Kashaya, which is already explained, which is having Gandha Dravya, and this Gandha Dravya has capacity to stimulate the olfactory neuron. So the Shmu Pitokrayati Kashaya and Elakanadi, these two Kashayams are effective in this stage 1. Even if the Shita Rutte and if the patient is at the Samprapti, here we can Asavarishta, Dashumolarishta, or Asso. The Sursadi Gana, which has been explained in Ashtana Udaya. When looking for the Falashruti Sursadi Gana, amazingly, whatever the symptoms, mild, moderate, and symptom, so that has elaborated by having the Falashruti of this Sursadi Gana. And this Surasava, Vaidyaratna company is available in the market, and Dr. Ganesh has taken care of a lot of patients by means of this Surasava. He is having a clinical data also about the Surasava, effect of Surasava in COVID management. Churna, Panchakola Churna, Talisadi Churna, Sitopaladi Churna, Hidrakanda. If already the patient is having history of allergic rhinitis, allergic laryngitis, allergic bronchitis, so and will be more. So Sitopaladi and Talisadi, Agni Mandya, Rajesh, both are effective. In stage 2, patient is having cough only, X-ray is clear, COVID score is 0. Here, so we can consider the pathology is moving towards the now it is released from Narayan and Gala, from it is or in the respiratory system. So here we have to consider Udana Vayu as well as Prana Vayu. So both these and curve also. So in according with these three factors, they can recommend Neopayam Kashai, Brahmayopayam Kashai, Balajkadi Kashai, and Elakanadi Kashai. Here the role of Vasarishta is there. If Santapanasta is there, we can employ the Vasarishta. Now, the first time I am mentioning about the Agadha. So in the first slide, some they are treating it as Visha. Toxins, whatever they produced by this virus or the inflammatory factor that are looking six and all. So we can consider it as a Visha. And in accordance with that Visha, some pharmacologically active, very having potential action of agar, and these are available in market also. So Bilvadi Gulika is a beautiful, fantastic if that agar is available in the market also. This Bilvadi Gutika in this stage 2. Next. Next slide. Okay, now CT score is up to the 5. Patient is having complaints of symptom of cough and little bit dyspnea or shortness of the breath. So here, the Samprapti has been accelerated deep into respiratory prana or Srotas. So what treatment protocol we can give? Here, Vyadhi Kasha, specifically Kapha Pradhan is there. Vyadhi Kasha is having a good results on that. So Balaragadi Kashaya, Vyadhi Kashaya, and Shungyadi Kashaya, Karkat Shungyadi Kashaya. So this all this kashaya is having a tendency to get penetrate more deeply inside the respiratory system or pranavas process and is to take care of this primary stage of pneumonia. Avaleha kalpana. So here in previous slides that churna. So churna is effective in nasa, gala, and upper respiratory. So for the Dhamitva or particular Srotas Dhamitva, we have to choose Avaleha Kalpana for this stage 3. In the further stages, Avaleha Kalpana will be more effective. So Avaleha, Taris Patradi Avaleha and Haridra Marichadi Avaleha. Haridra Marichadi Avaleha is having a very good in allergic condition, allergic asthma, allergic bronchitis. Now the Samprapti has accelerated toward the bronchitis. In previous slide, nose, upper respiratory tract, and now lower respiratory tract. So Vyoshamruta and Dushi Vishari Agar. In previous condition, I have recommended Bilvadi Gutika. This Vishari Agar is also available in market. In the taste or antidote about the Dushi Visha. So Dushi Vishari Agar is having the role in this condition. So these conditions are only just representing the respiratory condition. Along with fever is there, we have to give Gudu Chati Kasha. Along with this, if is increasing and bilirubin is increasing, so according to the other symptoms and investigation also, along with this particular protocol is only for it is and it is for, but we have to analyze the disease condition and the condition of the investigation profile also. So we have to add on this drug along with the previous protocol for the management of the pneumonitis. Here are the next slide, please. Next slide. 5 to 10. Now the pressure increases. Patient also become cautious because numbers language of number. Everyone likes the number language of number. When score is more, ultimately the pressure burden will be more. So here we have to think about Bharatmayopayam Kashaya and Indukanta Kashaya. Indukanta Kashaya already explained in neutropenia opinion. Rajakshma Adhikar Ashtanga. So Indukanta Kashaya and Bharatmayopayam Kashaya, not Bharatmayopayam Kashaya. So it is having in this disease condition. Here Kantakari Avleha. Avleha Kalpana I recommend particularly when the disease is processed deeper and deeper through the as Kankas and now the agar One stage, that is Bilwadi Gutika. In second stage, Gushi Vishari Agat. Now, a single medicine in the fellowship, this particular medicine is specific for the Pitta purpose. This medicine has been used in and all. But dealing with the Patolopatroinadika, Visha, particularly Visha has been explained. So this Patolopatroinadika will be helpful fighting against this spore also, fighting against the Rakta Dhatu, Mons Dhatu Samprapti also, and even the toxic effect of toxins and interleukin 6 also. Next slide. Next slide. So stage 5. CT scan more than 15 or 10 in between 10 to 15. So we can here ras. So Mahalakshmi Vilas Ras, Vayu Gulika, Kasturi Bhairav Ras, Sanjeevani Vati, and Swarnape Sweet Shaker Ras. So Rasikal, I found that in this particular stage we can apply or we can introduce the Rasaushati. So Mahalakshmi Ras is having the good role over the respiratory system in fighting against specifically WBC. So whatever the role, every Narayan Jadhav has also explained and Rahul has also explained the role of WBC in the pathology of the. So after fighting, we get introduced of COVID-19 to the WBC. WBC process inflammatory marker. This inflammatory, if there is more, ultimately the pathology will become more severe. The inflammatory matter, inflammatory factors, if they release less in number, the pathology is within control. So at this particular stage, we have to add the in a small quantity, they are having potential against the Samprapti. So here Mahalakshmi Vilas, Vyadhi, Bharat Kasturi Bhairav, Spati and Srotas. Next. Next slide, please. Now CT score is above 15. Oxygen saturation drops. Even the D-dimer, ferritin, the level increasing. Patient little bit unconscious, semi-conscious state. And here, I think very less options are there in our hand. So only we can introduce RT or Basti. Basti, it is difficult for to introduce the Basti in ICU setup. So here, Gulika, Shwasakasa Chintamani, so Shwasananda Gulika, and Kaya Visha Parihari Gulika. So Kaya Visha Parihari Gulika, which is routinely practiced in Agar Tantra in South, having a good potential effect on this particular state of the disease. Vishaveka, in what is the Vishaveka get accelerated in the Dhatu. So Kayavishari Gulika, last option in that particular argument. So if introduce Kayavishari Gulika, maybe that will reduce the pathological risk. Next slide. Next slide. Yes, so this is all from my side. I will conclude this session by just in 2 to 3 minutes. Primarily, I give you the scenario of the COVID-19 protocols. The second, according to a Kaichikisa person, I have enlightened over the probable Samprapti of the COVID-19, and then I have made some stages of the Samprapti. In accordance with that, some protocols for that particular treatment of the agent. So this is all from my side. So any question, it is answered. Yes, Rahul has asked the sir, any insight on the cytokine strain in COVID-19 patient? Yes. So cytokine and interleukin 6, all these inflammatory markers are there. When any external factor it get introduced to our body, so it it had to face the different level of defense inside the body. The first level of defense is the macrophages, which is a part of the monocyte. The total modus operandi of this fighting, phagocytosis. The second level defense is of a neutrophil. Third level defense is a monocyte. Fourth level defense is the T lymphocyte, and the last defense is a B lymphocyte. So B lymphocyte produces antibodies, and the rest of these defenses, the mechanism is phagocytosis. So while this thing happens, when this particular antigen has been introduced to the defense system, then defense system releases n number of photactic factor, that is inflammatory factor, and this factor spread throughout the body, and which commonly attains the total body system towards this particular inflammation process. So this factor is important for defense, but here in this COVID-19, so this factor, if they produce in a large quantity, so that can cause a severe involvement of the various organs and system in the pathology. So most of the time happens while in the autoimmune disease and in the others also. Itself, this inflammatory factor, they are causing a lot of trouble. So for treating this particular, so modern science, they have introduced anti-inflammatory drugs like steroids. So increasing dose of steroids that have introduced for taking care of this cytokine storm. While describing this condition in the Ayurvedic terminology of pathophysiology, already I have explained in the Sannipata Jwara, two modes of Samprapti has been explained. One is the Dhatu Pako and one is a Dosha Pak. If Dosha Pak is there, it is good for us. Dhatu Pak is there, again, that indicates the loss of our basic dhatus, that is cytokine storm. So that condition lead towards toxicity. So here, the various protocols and specifically Gruta Kalpana I have introduced in that particular stages only for taking care of cytokine storm.
Okay, sir. Thank you. Thank you very much. Actually, when we decided that we should take this, we should suggest this topic to you. Our idea was that there is so much information about the different treatment protocols of COVID-19, and things were not really black and white because the COVID has a very big spectrum, like you said. So these different protocols, many people didn't know where these protocols will fit in that spectrum. And frankly, I have seen many webinars on COVID-19, but I have never seen such a detailed description of dhatu-wise dosha avasthanusar and stage-wise HRCT stage-wise detailed description of what should we use in Churna, Asavarishta, and Gruta Kalpana. So I think it's a very informative session, and I think it will be a gem, and YouTube viewers will really benefit from this, and students should really watch it once it's available on the YouTube. Even many people were not able to see it on live, but it will be available on YouTube, and I will really appreciate it if students should come and see this. Such a detailed description of how the treatment of different stages of COVID should be. Thank you very much, sir. Thank you for your time. Thank you for the insight. And we will look forward to having much more insight from you in the future. Thank you very much. So we are concluding.
At last, yes, at last, to express my gratitude against our respected principal, Dr. Vijay Kulkarni sir, the faculty dean, Dr. Hemant Toshikani sir, all my colleagues in the Department of and here in the Parliament of Ayurveda and Research. They are continuously updating me, and here we have got the medical college in our campus also. So the physicians who are treating the cases of COVID-19 also continues in demand with protocols of the COVID-19. So I am very much thankful to this campus of Parliament Institute of Ayurveda and Research also. Thank you very much.
Thank you, sir. So this concludes our this session. The next session we have Dr. Sachin Tike sir, HOD of the Panchakarma department, Osmanabad, GSU Osmanabad. That session will begin in just 5 minutes. So it is actually live. We just have to take some. We just have to do some preparations. So don't go anywhere. Stay tuned.
Hello.
Hello, sir. Welcome.
Thank you, sir.
Hello, sir. Good afternoon and welcome. Uh, uh,
Good afternoon, sir.
I will tell the viewers that our next session has begun. And for this next section, we are Dr. Sachin Tike, sir. Dr. Sachin Tike, sir, is Assistant Professor and in charge HOD of the Panchakarma Department, Government Ayurved College, Osmanabad. We are very lucky to have him and to have his insight. Sir, you can begin anywhere, anytime you are ready.
Okay, I have to change slides by myself only, no?
Yeah, sure, sir. You can share slides by yourself.
Okay. So, very good afternoon to everybody. Myself, Dr. Sachin Tike, and first of all, I thanks to organizers for giving me this opportunity to present the presentation on COVID, role of shodhana in COVID. So I'm working as an assistant professor and in charge of HOD since 10 years at the Government Ayurved College, Osmanabad, Maharashtra. And now we will move towards the presentation. So, as previous speakers have enlightened what about the coronavirus and what is the Ayurvedic aspect of this. So I will not go detail in this. I will. Hello. Am I audible, sir? Jadhav, sir.
I can't see the PowerPoint, sir. I will share.
Hello. You can't see the PowerPoints?
No, sir.
But I opened the.
No, you have to share it, sir.
I will come back.
Did the trial.
You are in show.
Or I can do it for you. Should I do it for you? I have your PowerPoint. Yes. Okay, I will do it for you, sir. I have your PowerPoint.
Okay. I will go back and again I will build so that I can change from here.
Okay, sure, sir. You can. तुम्ही आधी ट्राय करा सर, नाही झालं तर मी करतो.
हॅलो. हा सर, आता शेअर केली मी स्क्रीन, आता दिसते ना? अच्छा सर, चालू करू दे.
हा सर, आवाज येतो सर तुमचा. पॉवर पॉइंट पण दिसतंय. यू कॅन कंटिन्यू.
ओके सर. So sorry for the Srotas by this modern technology. and myself, Dr. Sachin Tike. I'm working as assistant professor and in charge HOD since 10 years at Government Ayurved College, Osmanabad, Maharashtra. And I really thankful to the organizers of late BVK Ayurved College, Latur, and especially Jadhav sir and Khandare madam for this nice arrangement. And now we will move on towards the presentation. So, role of shodhan karma in COVID-19. So, as the previous enlightened speakers already shared about what is corona or what is the Ayurvedic aspect of coronavirus. So, I will not go in detail or deep in that, but still we will just touch or brush the subject and we will move towards the Panchakarma. So, what is coronavirus or SARS-CoV-2 as per Ayurveda? So, microorganisms are described in the name of Pishacha, Rakshacha, or Nishachara, or Raktajakrami in Ayurveda, because this is the ancient science, holy science, which is originated or formed 5000 before. So, at that time, the modern scientific methods or microbiology or microscopes or electron microscope are not there. So, they have labeled it as Pishacha, Rakshacha, or Nishachara, or Raktajakrami, sorry. And there are numerous anuchara. They have mentioned that there are numerous anucharas of grahas, and that we can think of they are nothing but the microorganisms. Tesham grahanam paricharaka ekoti sahasrayuta padma sankhyayaha. So we can think of this anucharas of grahas or raktajakrami as the COVID-2 virus. So this SARS-CoV-2 may be considered as a type of either Rakshasa or Pishacha. Then we will move towards Daiva Bala Pravarta Roga. They are Upsargika Rogas. They are contagious Rogas. They are again two types, Vidyuta Dashanikrata and Pishachadikrataj. And again they are further subclassified as a Samsargaja or Akasmikasha. And these Samsargaja diseases, we can think of contagious diseases or epidemic or pandemic diseases. And they are progressed by microorganisms in terms of Rakshasa or Pishasa as per our ancient science. So we can't think or label that there is no diseases like this mentioned in Ayurveda, and we will come to that point. How can we think of that diseases are also mentioned in Ayurveda? So now communicable diseases as per Ayurveda. So the Ausargika Rogas as per Srotas, he has mentioned in Sutrasthana. Ausargika Rogas are also called as Upadravas. And there are mainly two types of Upadravas. One is psychological. So definitely we have seen that few patients or many more patients of COVID-19, they have lost their lives just because of fear without coming report, whether they are positive or negative, or whether starting before the treatment, once they get the report of they are positive. By that only Bhayaja, they have not able to live, and due to that shock, many of patients cardiac shock or suicide attempts, or in quarantine or in isolations, they have made suicides because of that bhaya. So one complication of this microorganisms is of psychological imbalance of mind during the incubation period of this COVID. We can think like that. And complication of other systemic diseases means we can think of comorbidities like hypertension, cardiovascular diseases, or diabetes and cancer, like that. Other comorbidities, and they will aggravated due to this infection of COVID. In Ayurveda, the obstetric diseases are labeled as Kushtha, Jwara, Shosha, Netrabhishanda. In this regard, we can think of Jwara. So, in COVID, we also find that in maximum cases, a patient in one or other stage get afflicted with the Jwara. If this diseases occur as a complication of microorganisms, then means Rakshasa, Pishacha, or SARS-CoV-2, we can label it as a communicable diseases. So what may be the probable pathogenesis of epidemic or pandemic diseases? So I think Narayan Jadhav sir has touched this point. Adharma. Vayuadinan yad vaigunyat utpaddayate tasya moolam adharma. When Vayu Vikriti, Jala Vikriti, Desha Vikriti, Kala Vikriti, climate change occurs, then Pindete Brahmande, the same Nyaya is also applicable to the body also. So, dosha visheshan due to invasion of Kruddha Rakshasa or Pishach means what occurs in Brahmandi that occurs in Sharirupa Pindi, and that causes observic rogas and that affect a mass of people through contamination. So when it is countrywide, then it is called as epidemic. When it is a globalized, then it is called as pandemic. So this is an example of Janpad Dhons, which is explained in Charak Vimanasthana, and COVID is like Janpad Dhons Vyadhi only. And probably what diseases can be compared with the COVID-19? It may be included under the Kaphaja Jwara, Vata Kaphaja Jwara, Sannipata Jwara, but mainly it can be compared along with these signs and symptoms with Vata Kaphaja Jwara as per the manifestation. Even though coronavirus is the main victim as per modern science, but as per Ayurveda, it is only nimitta karana, because without the vitiation of the doshas or without the involvement of the doshas or without the imbalance of the doshas, disease can't occur in the body. So sarvesham cha vyadhinam vata pitta sleshmana eva moolam tad lingatvat drashtaphalam agacha. So without the involvement of vata pitta and kapha dosha, disease will not occur, and by seeing the concerned doshas symptoms, and if we will treat as per the symptomatic doshik lakshanas, we will get the result. And before slide in that, I have told that how we can include that any new disease, how we can include in the Ayurveda that nasti rogo vina doshe yasmat tasmat vichakshanaha anuktamapi doshanam lingay vyadhim upacharet. So if any diseases which I have not explained in Sanhitas, that for that diseases we have to see the lakshanas and we have to treat accordingly. And what modern science says, if any new disease, what we have done or what the world medical fraternity has done about the COVID symptoms, treat the symptoms. Still at this stage also we don't have any accurate Ramban Upay for this. We are treating symptomatically accordingly. Sometimes this drug works, sometimes that drug works, then we will get adverse effect of that drug, then we will change that drug. This type of treatment is going on. And during fatal conditions, these jwaras can cause shwas causing death. So it's a pandemic. So now we'll move towards the Panchakarma. So Panchakarma is not only curative aspect, but it is a preventive aspect also. So swasthasya swastha rakshanam aturasya vikara prashamanam cha. So not only to continue the health, but to cure the diseased person, both values or both the prayojana is of Panchakarma. So now we'll move toward the role of Rutu Shodhan. So whenever we transform in from one Rutu to other Rutu, the last period or last week of first Rutu and first week of coming Rutu, we call as Rutu Sandhi Kala. So if we will not follow this Ahara Vihara Rutu Dincharya, Rutu Charya in that particular period, then we will get Asatmaja Vyadhi, because in Vasanta Rutu, Kapha Prokop is there. Why Vasanta Rutu has been taken here in this slide? Because February, March, April was the incubation or spreading period of the COVID all over the world, starting period. So that was Vasanta Rutu. In that already Kapha Prokopa is there, and if you will not follow the Rutu Sandhikal, Rutu Charya, then Kapha Prokop will be there, which will lead to Agni Mandya, and then due to Vata Kapha predominance, the Vata Kapha Vyadhi will occur, and one of that is Vata Kapha Sannipata Jwara, which we can correlate to the COVID-19. So if we will follow proper Rutu Shodhana, then we will have edge to fight with the COVID. Further of that, we can think of following proper dincharya, rutucharya, and rutu shodhana and ratricharya also. Because in dincharya, we will neglect it. Ki what is abhyanga, or just by putting oil on head, what happens? But abhyanga means shiro abhyanga, kavala, gargling, gandusha, holding some medicated oils in the mouth, or pratimarshanasya, medicated drops, or murdhitaila, pichu, shiro seka, shiro abhyanga, shiro basti. But in that, at least we can do shiro abhyanga daily. At least male candidates of our age, at least definitely apply oil to the head. So these dincharya, if we will follow regularly, then we will build our immunity. So it will give a immunomodulatory effect or preventive effect to the body to fight the diseases throughout the year. And the same like rutucharya. How we do is that in the Shita Rutus like Hemanta, Shishira, Ushnagraha, Snehana, Svedana, in Grishma Rutu, we have to think of Chandan Mala, Chandan Lep, like Shita Chikisa, Bruhan Chikisa. If we will follow this, then we will get some immunity to fight against the diseases which will particularly come. Particularly kapha is applicated or samsarga with vata, means kapha vata. Then we can think of basti virechana, and naturally for kapha nasa is there. So we can see that in Vasanta Rutu Vamanakam do proper kapha or kapha pradhanya. So in Sharad Rutu, naturally their pitta vridhi will be there. So using tikta kagrata, snehapana, then we can think of virechana. And again after samsarjana and rest, and then Vishrantika, after completing Vishranti kala properly, we can again think of Dipana Pachana, Panchatikta, Mahatikta, Grata Snehapana, and again Raktamokshan. So I think that bloodletting or blood donation, we can attach with the Raktamokshan, then it will be beneficial for both the community, the blood banks, or to the patients also. And other Rutu is Varsha Rutu. So Varsha Basti, Varsha Kalina Basti. Because in Varsha, main dosha, that is Vata dosha, is elevated, aggravated. It is not in the balanced state. So to do the Vata balance or to Vata Shaman, we have to think of Niruha Basti, Anuhasan Basti, Yoga Basti, Matra Basti. We can consider Matra Basti in Dincharya also. So if we will give Rutu Shodhana to the patients as a preventive aspect, immunomodulatory aspect, if we will highlight this concept, if we popularize this concept in at least India, then the people will have immunomodulatory or preventive effect, or they have inbuilt immunity to fight against the elevated kapha, elevated pitta, and elevated vata, so that they will not get the diseases in the concerned rutus. So if we will properly follow dincharya, rutucharya, and rutushodhana, and if we will give the impact or give the impression or give the importance of this rutucharya and dincharya and rutushodhana to the mass people, all countrymen, then we can think to control these pandemic diseases, and we can build immunity. Herd immunity is different, and this Panchakarma made immunity will be different. So this is again, we are preventing them from getting infected. So role of deshas. So in cold climate countries where temperature is low, or in some countries -degree, always ice will be there. So there, this COVID-19 has more progressive and rapid spread. We have noticed example in Italy, New York, United Kingdom, Brazil. So again, it means that Shitaguna in environment elevates or aggravates the Vata and Kapha dosha, and which helps diseases to spread rapidly. So again, Desha, Kal, Vayu, Jal. These all are the factors which comes under the Janpad Dhausa, and same we have to think here regarding Corona. So treatment. So here we have to think of Kaphaja, Vata Kaphaja or Sanipata Jwara or Raktajakrami, and for disinfection or fumigation of areas or hospitals or houses or common facilities areas, we can think of Dhupan of by Sarshapa, Neem, Saindhava and Grita twice daily up to 10 days. That is what mentioned in this shloka. Dvirahana karyat dhupam dasharatram atandritaha, so that microorganisms will get less power or will get vanished. Or we can think of fumigation by Gugulu, Agaru, Sarjarasa, Vacha, Shweta Sarshapa, Lavana and Grata should be done. It's a preventive measure. Aseptic precautions. Sanitization. We can label or we can think like as sanitization. How we can think of sodium hypochlorite, Savlon, like that we can think of fumigation. Sanitization of the areas to prevent from the viral load or to decrease the viral load. Management as per Charaka. So here he has mentioned karma panchavidatesha bheshajam paramuchyate rasayananam vidivach upyoga prashasyate. So in Charak Vimanasthana, while dealing with Janpad Dhausa Vyadhi, Charakacharya has mentioned along with bheshaja in Janpad Dhausa or pandemic diseases, along with medicines, rasayana chikitsa, karma panchavidham means panchakarma is very much essential to save from the effect of Vikrata, Vayu, Jala, Desha, Kala and pandemic diseases. So we get the reference from ancient texts that Panchakarma has a definitive role in Janpad Dhausa Vyadhi like COVID-19. So here the COVID population has been categorized stage-wise, group categorized, so that we'll come to the conclusion ki in which group, in which stage, what Panchakarma we can think or plan of. Okay. So in group, I have made 3 groups of population and then subgroups, but mainly 3 groups are, one first group is healthy population, means they have not infected yet by COVID-19. And then group second, which is infected population. And then group third is cured population, healthy population. Second group is infected population. And group third is cured post-COVID population. So in group 1, the subgroup is no exposure. They are not exposed to any environment or any infected people, or not. They have not went to the contaminated zone also, or containment zone. Weak immunity. And third one is exposure through travel or infected persons. Third group is they have infected, exposure of infected persons through travel or directly by infected person. And fourth one is health workers, all health workers, medicos or non-medicos, or in they are working in lab, or they are in dispensing the medicines. And other group is infected population, suspected cases with no symptoms, or confirmed cases. Other group is confirmed cases but with mild symptoms. Third subgroup is confirmed cases with moderate symptoms. Then fourth, confirmed cases with severe symptoms. Then confirmed clinical illness, critical illness means they are in ICU or they are on ventilator, most critical cases. Then group third is cured population. They are having avarabala, madhyama bala, or pravar means post COVID, due to their incubation or due to their flow of disease, how they have treated or how they are affected, they are having avara, madhyama, or pravar bala. So these are the three groups. So now we'll move group by group and what Panchakarma can be done in groups. So in group 1, Abhyanga. So Balataila. So in group 1 means healthy population. Abhyanga is done with Balataila. Then Anjana. Anjana is done with Sauviranjana. So healthy population. So we can think of Abhyanga with Balataila, Tilataila, or whatever available taila that is in coconut oil also we can think of Abhyanga. Then Anjana, Sauviranjana. Now we can think of why Anjana is made here. But if we will see the references, that in 7th Vega of Vishavega they have mentioned the Anjana. Then in Kamala they have mentioned the Anjana. Then in Jvara, Ashtanga has mentioned Anjana. So in Dhupana, in Dhumapana, Snahika Dhumpan. So here Brohan Chikisa is needed. Then Dhupana. So it's a fumigation. Then in Dhupana, Yavani, Haridra, Tulasi, Vacha, Nimba, Vidanga, Gomaya. So we can do the fumigation as a preventive aspect. Then Aparajita Dhum, which is mentioned, I think, in Vishamajora Chikisa in Ashtanga Hridaya. Then Rakshogna Dhuma. Then Nasya. Nasya is done with Anutaila or Tilataila or Goghrita. Or if patient is not affordable, we can think of just coconut oil and along with that Nasya. Then Karnapurana. Karnapurana with Tilataila, because it's one of the Sparshanendriya organ. Then Gandusha with a Tilataila. Then Kavala. Gandusha, Kavala. These are the easiest methods that patient can do at home. Triphala plus Yashtimadu, Haridra, Tulasi, Saindhava Koatha, Kavala can be done. So, why Gandusha and Kavala? Because this lipophilic media will not permit the viruses to attach. So, this Gandusha and Kavala, they will look like a simple procedures, but we can prevent the viral infection through Gandusha and Kaval. And Murni Taila, Badam Taila, Mahanarayan Taila, Bala Taila, Kshir Bala Taila. So in this, patient will be psychologically disturbed. So we can think of Shurodhara or Shuro or Shuropichu. And at the end of the seminar or concluding sets, I will tell what precautions should be taken for doing Panchakarma. But these are the small procedures we can teach them. We can teach the patients so that they can do at home without infecting other people or without getting exposure to hospital or travel. So group second in Panchakarma in group second. So group second is in infected. So in this subgroup 1, suspected cases, means they have given RT-PCR samples, but they have not able to get reports to, and no symptoms. So in that we have given Nadi Sweda, steam inhalation with Tulasi or Haridra water. Tulasi or Haridra or just Dashmula, steam inhalation. If they will not get anything, we have vapor caps that we can use. Then Kavala. So Tulasi, Haridra, Triphala, Yashtimudu, Saindava, Siddha, Jala, Kavala. Dhumapana, Madhyama Dhumapana. Madhyama Dhumapana means snake Dhumapana or Shamana, snake or Shamana. We are not supposed to use here Tikshna Dhumapana because no symptoms or suspected cases. Pimpli, ST Madhu, Sharkara, Khanda Sharkara, we can think here, Aragvada, Manjista, and Sugandhi Dravyas can be used for Dhumapana. So, in suspected cases, why we are advising steam inhalation, Kavala, Dhumapana, so that if the viral load is less, they will not go in second stage. There will be a blockage to the stages of the viral infection due to these measures or aspects. Then subgroup 2, confirmed cases. Confirmed cases. So here they are confirmed report of COVID positive. They are having mild symptoms. Alpa lakshanas are there. And so if they might be in quarantine centers or they are in home isolation. So for these patients, we can advise Nasya. Nasya with Anutaila, Shadbindu Taila, Tila Taila. So just we have increased the intensity of drugs here, Shadbindu Taila. Then Kavala with Trifala, Yesti, Haridra, Tulasi, Sendhavadi Kwatha. Then Gandusha with Tila Taila. Why? Because in these cases, upper respiratory tract is more vulnerable and we want to block the infection at upper respiratory tract only. So we are targeting on nasal cavity and mouth oral cavity. So we are giving Nasya, Kavala, Gandusha, Dhumapana, Madhyama Dhumapana, Anjana, Savir Anjana, Shiro Abhyanga with Brahmi Taila or Mahanarayan Taila. And these are the procedures which we can teach on WhatsApp call or one demo, and then patient can do at their respective homes. So the viral infection will not go in second stage, it will not aggravate, and it will block in first stage, and it will get decreasing day by day along with the modern medicines. So in group second infected population, subgroup third, they are confirmed cases, but they are with moderate symptoms. So in that also we can give Panchakarma like Nasya, Vitanu Taila, Shadbindu Taila, then Kavala, Triphala plus ST Madhu, Haridra, Tulasi, Sendhava Kwatha, Gandusha, Tilataila, Dhumapana, Madhyama Dhuma, then Murni Taila. In here also we can think of, they are confirmed cases with moderate symptoms, means they will be psychologically in shock. So we can think of Shirodhara. If they are not having cough and cold, we can think of Shirodhara. Otherwise, just Shirabhyanga with Brahmi Taila or Manarayan Taila. Then Vamana. So this point should be noted that Vamana is recommended, Sadhya Vamana. But when, if Utklishta Kapha Dosha with Sama Avastha or Navajara. So in Navajara with Utklishta Kapha Avastha and in Sama Avastha, Vamana is indicated. But by using Yukti Pramana, whether Vamana is beneficial as compared to the complications or other side effects of Vamana, we have to think of. Because if patient is in home isolation, if patient is well versed with Vamana, in previous he has taken Vamana, then he can go for Sadhya Vamana at his home. Or if we are giving Vamana in our isolated Panchakarma center with using all aseptic precautions, using PPE kit and N95 mask, and proper disposable will be there, fumigation before and after will be there. So if all these facilities are up to the mark, then we can think of Vamana. Otherwise, we are not supposed to do Vamana, because through Vamana, the droplet infection again may spread, and the health workers or the Panchakarma staff can get affected due to droplet infection to the viral load or virus. So here we can think of Virechana. Mrudu Virechana is recommended, mainly Sneha Virechana, that is air under Sneha or Aravad Kapilavati. We can think of Sukha Sarakwati, like mild Virechana Dravyas we can think of, because in these cases the patient will be home isolated or some center isolated, quarantine center will be there. So no proper exercise or movements and psychological disturbance. So there will be constipation. So to rule out that constipation, we can think of mrudu virechana. Then in this stage, we can think of Salvana Nadi Sweda, which is a specialty explained in Susruta Sanhita. Sa Lavana. We can think here Tilataila or any narikela or coconut oil which is available at home. We have to add Saindhava, and then we have to apply it on chest and back and flanks region, and then give Nadi Sweda. And if it is not possible to give Nadi Sweda, we can think of hot water bag fomentation, Valuka Sweda, then Istika Sweda, or just by putting towel or napkin in hot water and then squeezing it and just applying on chest and back, we have to give fomentation, hot fomentation. So it will help to relieve the kapha, stanne kapha. It will help to dilate the bronchioles. So it will definitely relieve from breathlessness or breathing problems, and it will help to increase the saturation, SpO2 saturation. So in group second of Panchakarma, subgroup 4, confirmed cases with severe symptoms. So they are having severe symptoms. In that, we can think of the drug intensity will be should be increased, like Shadbindu Taila for Nasya, Jyotishmati Taila for Nasya, Kavala with the Triphala, St. Haridra, Tulasi, Saindhava Kwatha. Or if it is not possible, just hot water gargle with salt or with Haridra, which is available at home. Then Gandusha with Nimba, Trikatu, Saindhava, or just by Saindhava and Haridra. We can think of golden milk also. Golden milk means not real gold milk. Haridra plus milk is also called as golden milk, and that is sold at a higher price in foreign countries. And when it something comes from a foreign country, then our Indian mentality is to accept it. So only Haridra milk means they will not accept. But if it is called as golden milk and that they are using haphazardously in or in mass population in foreign countries, then they will follow. So this also help us. Then Dhumapana. Here Tikshna Dhuma, Jyotishmati, Haratal, Apamarga, Trifala. And after giving Tikshna Dhumpana, Vairechanika Dhumpana, to avoid the Vata Prakopa, we have to think of Snehika Dhuma. Then Vamana. So it is having confirmed case with severe symptoms. It may be hospitalized, maybe in ICU. So Vamana is not recommended because Yukti Pramana, and we have to think of Dosha Bala, Vyadhi Bala, and specifically Rugna Bala, along with that Rugna Manasika Bala. And considering by all these factors, Vamana is not at all indicated in this confirmed severe symptoms. Then Virechana recommended. सौम्य विरेचन गंधर्वर्ती की चूर्ण, आरगवदक पिलावटी, सुखसारकवटी, आयुपत्तिकर चूर्ण. We can think of these. Then Murni Taila, Brahmi Taila, Mahanarayan Taila can be used for Shirabhyanga, Shiropichu, or Hastapada Tala Pratisarana. Then Salvana Nadi Sweda, Saindhava, Tila Taila, chest and back application along with flank region. Then hot water fomentation or hot water bag fomentation or Nadi Sweda to relieve from the upper respiratory or lower respiratory symptoms of the patient. So we can think that though these Panchakarmas are mentioned in stage wise, but again by using Yukti Pramana, by seeing the Dosha Bala, Vyadhi Bala, patient's Sattva Bala or Manasika Bala, we have to think of whether Panchakarma is necessary, whether Panchakarma is indicated, whether this Panchakarma patient can tolerate, whether this Panchakarma will yield positive things. And by using all these factors, considering all these factors and using Yukti Pramana, we have to think of Panchakarma. Then group second, in that subgroup 5, confirmed cases with critical illness and complications, like the patients on ventilator, patients on high flow nasal cannula, patients patients with RTs, patients with catheters, patients with multiparameters. They are in admitted in critical care unit ICUs, or with some complications like EMI or pulmonary embolism or deep vein thrombosis, with altered sensorium, with fault, SpO2, SpO2 below 85. So in that condition, we should think of Shama Chikitsa, not the Panchakarma Chikitsa. So it is an emergency condition where the Panchakarma is not advised at any condition. So in group 3, post-COVID cured cases. So government also now starting post-COVID treatment centers, because we have seen that in some post-COVID patients, they have lost their vision. Some post-COVID patient, they got cured and they started normal living and they went to job, and then they got the myocardial infarction attack and then got death. Or some patients having cough, some patients having myalgia, severe myalgia or weakness. It means that we are not supposed to ignore the patient after just getting COVID treated, or post-COVID, or rapid negative or RT-PCR negative. If they are negative, but still there will be khavaigunya. The damage done by the disease will be there, and it will take some time, recovery time. So for that, abhyanga, nitya abhyanga, at least they should come weekly, 1 or 2 times to the Panchakarma theater with Panchakarma physician, or before that daily they are supposed to apply at least pratisaran. The patient can give or do pratisaran to his body parts at home. We have to advise depending upon the bala. If our bala, chandan bala laksha detail. If madhyama bala, just bala Narayan tail, like that. And depending upon the affordability, depending upon the stage, we have to think of the which taila can be applied, or just coconut oil can apply patient before going to bath, before half an hour before that, so that some absorption will be there, and then patient can go for warm water bath. Then nadi sweda. So here nadi sweda can be given with dashamula, or just hot water fermentation after snehan, or I told like that some water dipped in hot water, squeezed, and that can be kept on chest, so that nadi sweda along with salvan nadi sweda can be done. Then gandusha with just tilatail, coconut oil, or gograta. Kavala with just madu, esti madu, bala, esti madu bala, siddhak sheer, we can think of. It will give balya, because due to the long standing stay in hospital, or due to medicines doses, that aruchi will be there, loss of taste will be there, loss of appetite will be there. So there this gandusha and kavala will come to the use. Then bruhananasya, like shirbala tail or shirbala avartita 101 tail, we can think of. Then for bala, we can think of yapan basti, and among the yapan bastis, we can think of mustadi yapan basti. But when only if there is no persistent cough or breathlessness, means kasa shwasa has decreased, or patient is free from kasa shwasa after post COVID. In that, because as per Shastra, in kasa shwasa basti is contraindicated. So it will again push the pratilom vayu upwards. And as we know, purushasya balam hi vidbalam. In Yakshma it has been come. If patient is having diarrhea, atisar, then we are not supposed to give basti. So considering these factors and the present patient complaints, patient's condition, we can think of basti. And that too, which basti? We can think of matra basti then, just by bala tail, ashwagandha tail, or balagrata, ashwagandha grata. We can think of matra basti also. So it will not harm. So we have seen the Panchakarmas. But Panchakarma is always incomplete without giving proper Purva Karma and proper Paschat Karma. So, in all these, we have seen Vata Kapha predominance, Agni Mandya. So, Langan has its definitive role. So, Sausarjana Krama is important. Whenever there is ama, whenever there is aruchi, whenever there is a loss of appetite, we have to think of Lagu Ahara to Guru Ahara, that is Sausarjana Krama. And whenever we need it needed, we can think of Maunsaras Odana also. And Shamana is a part of Panchakarma. Means Panchakarma means only we will give Panchakarma and we will wait till the results. It is not like that. Samsarjana, Shamana. Shaman Chikitsa, I will not deal with it because it has been already dealt by Dr. Kore sir and other speakers. So Shaman Chikitsa I will not deal. Rasayan Chikitsa also might they have mentioned, but Rasayan is also important because disease is cured. But the Slishta, for the curing of Slishta dosha, remaining part of the dosha, Shamana is there and Rasayana is there to clear the Khavaigunya. So we can think of Chavana Prasha, Agasya Harita Kyavleha, or Shwasahara Kwath, like that, or Maharshi Chavan Prasha. We can think of these drugs as a rasayan, or just Amlaki Churna or Triphala Churna. We can think like for Rasayana Chikitsa. So, after doing this Shamana, Samsarjana, Shamana, and Rasayana, then only Panchakarma completes. So that these drugs are also variable person to person, patient to patient, and by using Yukti Pramana, we have to think of which drugs we have to use in Panchakarma and Paschatkarma. But the major issue comes whether we have to give Panchakarma, whether we have to start Panchakarma center, or whether we have to continue this Panchakarma center during this COVID pandemic period. So government has published the guidelines to be followed at Panchakarma center. So every day, sanitization of Panchakarma center and theatre should be done with 1% sodium hypochlorite. Doors are fitted with foot operated door opener. Means we can operate the door with foot without touching the handles and knobs. And wall mounted or sensor sanitizer dispenser should be there at the gate for health workers as well as patients. Then daily, before entering, thermal screening and SpO2 screening should be done. Then Dhupana Karma or medicated fumigation should be done regularly. Then doorknob, handles, and high-touch surfaces in the common facility area shall be cleaned frequently. Everyone must follow social distancing. Usage of homemade masks and respiratory hygiene practices are to be followed daily. Then training and education on updated information of COVID-19 is to be given to all health workers and patients. So according to the updates, we have to change our strategy. Then Pratimarshanarsha, regular use by staff of Panchakarma, so that, or Jalaneti, so that they will be not vulnerable to the infection, they are not susceptible, or they will be prevented from the viral load. Then what are the guidelines for the therapist before initiation of therapies? Patients who are above 65 years are having comorbidities like cardiovascular diseases, hypertension, diabetes, cancer, and the children below 10 years. They are not to be posted for Panchakarma. Then patient consent, Then routinely we will take the patient consent, but in this pandemic we should start the practice to take patient consent, and their COVID-19 status should be checked, whether they are using some Arogyetu or Sanjoni app, whether they are positive or not, whether they have come in contact with the infected persons, or they belong from containment zone or not. Then therapist and patient shall report any incidents of infection in the family or self in a pro forma made for that purpose. Means in consent form. Along with consent form, one pro forma should be kept there. In that, patients, therapists, and their relatives' information regarding the COVID should be filled up for the further record and further prevention from the infection. Therapist shall adopt the use of all disposables like droni sheet or disposable basti netra, and after each procedure, the droni or the procedure room should be cleaned by the liquid solution or soap. Then Panchakarma decoctions, potalis, or other medicines or oils. Generally, we will see that their oil will be taken in some bowl, and it will be used for the patient. And after that patient, if some oil will be there, that again reheated and that will be used for other patient. But now this should be stopped, and this practice should not be done because it may spread the virus or contamination. So we should take aseptic precautions, and we should not use the remaining medicines of one patient to other patients. So guidelines to be followed for the therapies. During the conduction of therapies, what precautions or what guidelines should follow? It is advised to handle one case at a time by one technician. It means that only one technician in he is handling one petis with patient, and side by side dhara is going on, and in his hand one nasya patient is there, and on other table cystic Shali is also going on. Like that, it should not be done, because again it will give more exposure to the therapist, and and he may get affected. So at one time, one technician, one patient, this protocol should be followed. And technician, Panchakarma Vaidyas or Panchakarma physician should use PP kit and N95 mask along with disposable headgear, then shoe gear, then face shield, or at least N95 mask and gloves therapist should use, and they should change the gloves for every patient. And if the mask is moist or become dirty or become wet, then they should discard and use separate new gloves and mask for each and every patient. It may increase the cost of patient because it is necessary. Then avoid therapies like Vamana, Nasya, Karnapurana as far as possible. Why? Because Vamana itself creating droplets. Nasya, therapist will go near the mouth and nose, and for Nasya, we have to remove the mask of the patient. And if while giving Nasya, the patient sneeze, again he will spread the droplet infection. And the same with Karnapurana. The patient will go near the external orifices of the patient, and to avoid the spread of virus, one should avoid the therapies like Vamana, Nasya, Karnapurana, or we can advise Nasya, Karnapurana, Murnitaila, at least Shurabhyanga, Shurupichu. We can teach to the patient, and we can tell them to do these procedures aseptically and in proper way at home, because something is always better than nothing, and it will again decrease the exposure of technician to the patients and exposure of the patients to hospital and all other traveling part. So we can think like that. Then what care should be taken after completion of therapies? To ensure the disposal of soap, shampoo, sachet, etc. after use. We should tell the patient to carry his own soap, shampoo, sachet, napkin, towel, or any other articles what he has brought from home to the theatre. Then, waste generated during the Panchakarma procedures, such as oils, liquids, cotton, empty bottles, empty containers, etc., shall be properly disposed as per the biomedical waste management rules, so that there will be no chance of spreading the virus from this waste. So designated area to be provided to technician, Panchakarma Vaidyas, and all other healthcare workers, sweepers for donning and doffing of PPE kit, so that while donning and doffing, the infection will not spread from one to other health workers. These are the minor things which can prevent the spread of the corona in the hospital, or from hospital to patients, or from patient to hospital workers. So this is all about the role of shodhana in COVID-19, and what are the precautions or guidelines should be taken while doing Panchakarma during the COVID. So, any questions, Sir Jadhav sir? I am concluding my session. Any questions? They are most welcome.
Yes, sir. Thank you very much, sir. Hello, sir. Can you hear me, sir?
Any? Yeah. I can hear you, ma'am. Any questions? They are They are welcome.
Is having
Hello.
any question? Okay, sir. I think there is no any questions for you.
Okay.
Okay, this is
So
okay.
I I thank you, my dean, Dr. Kapade sir, and for providing such a healthy atmosphere and all opportunities to work in the institute, and to do some research and good work in Panchakarma. And I also thank to the organizers from late BVK College, specifically Jadhav sir, Moje sir, and Khandare madam. And thank you one and all for giving this nice opportunity. And thank you all viewers for your patient listening to my topic. Thank you one and all.
Thank you, sir. Thank you very much, sir. Nice session. You conducted this session very well. Now the next session will begin in within 5 minutes. So please don't go anywhere. The next session concluded. This next session will be concluded. Dr. Snehalata Patil ma'am. She is HOD from our college, LBVK, Ayurved Medical College, Latur. Her top is she is the HOD of Stree and Prasuti Tantra department. She is associate professor from this department, and the topic name is the COVID-19 management in pregnancy. Ma'am will conducted her lecture within 5 minutes. Okay, thank you, ma'am. Yes, master. Yes, ma'am.
Hello and a warm welcome to all. I'm Dr. Snehalata Patil. I'm working as an associate professor in the Department of Street and Prasuti at LBVK Medical College, Latur. Today's my topic of discussion is COVID-19 and its management in pregnancy. COVID-19, coronavirus, these terms are not very new for us because we are being bombarded with these terms throughout this entire year 2020. And now we are heading towards the new year 2021, but still the threat of this deadly virus hasn't come to an end. It hasn't come to an end. Before to start the discussion of the core topic, let's take a quick review of COVID-19. Next slide, please. Next slide. So let's see the history of COVID-19 in a brief. So on 31st of December 2019, China has notified WHO of an idiopathic or mysterious pneumonia outbreak in Wuhan. On 7th of January 2020, Chinese scientists has identified a new virus, coronavirus. Then on 30th of January 2020, WHO has declared COVID-19 as a public emergency. And on the same day, first case of COVID-19 was detected in India also. Then on 21st of March 2020, WHO declared it as a pandemic. Next slide. Now let's see the positive agent of COVID-19. So the positive agent is novel coronavirus. It was previously known as SARS coronavirus 2. Basically, it is a RNA virus. There are multiple types of coronaviruses which are existing, namely alpha, beta, gamma, and delta coronaviruses. This novel coronavirus, it belongs to the beta group of coronaviruses, which are supposed to be the most vulnerable group of coronaviruses, and they are having the potential to cause situations like pandemic. And we are experiencing this pandemic right now, and the incubation period of this disease, it ranges between 2 to 14 days. Next slide. Now let's see the mode of transmission. Basically, the mode of transmission is from human to human. It mostly occurs through the droplet transmission. Means when an infected person coughs or sneezes, the droplets thrown out spreads and can infect another person who is standing nearby. So that is the droplet transmission, which is the most commonest way of transmission. Then the another mode transmission is fomite transmission. This RNA virus, this particular coronavirus, is slightly different from the other coronaviruses. room of the department. She should settle in isolated room. Temperature, fetal heart sounds, if possible, through the continuous electronic fetal monitoring system. Initially, Tigo has advised that cesarean sections as a preferred mode of delivery so as to avoid so these measures can be followed by every pregnant woman easily. So according to these guidelines, she should drink lukewarm water throughout the day. She can practice daily simple yogasanas, meditation with chanting like Omkar Gunjan. She can do some breathing exercises like pranayama. She can use turmeric. She is advised to use turmeric, cumin powder, coriander, garlic in cooking. These things are easily available in every kitchen. These are well known for their digestive properties. Turmeric and garlic are having some antiviral properties, and these can keep her away from getting infected. She is advised to take Chavanprash, Guduchi Sattva, Tulsi Swaras or decoction or Ayush Quad regularly. These medications are supposed to have antiviral properties, and these are also very well known immunomodulators, adaptogenics, and she should regularly consume all these things to keep herself healthy and disease free. And there should be nasal application of coconut oil, sesame oil, or ghee in each nostrils twice a day. It can keep the nasal passage or the nostrils moist. Then oil pulling therapy. Take 1 to 2 tablespoons of sesame oil, coconut oil in mouth. Do not drink, hold in and swish in mouth for 2 to 3 minutes and spit, followed by warm water rinse. Coconut oil and sesame oil are having some antiviral properties, and they can keep the nasal passage and oropharyngeal passage virus free. Then there should be breathing exercise like blowing balloons. This will immensely help the pregnant woman to enhance the pulmonary function, which will help her later on in the second stage of labor when she has to bear down to expel the fetus out of the womb. And these types of breathing exercises throughout the pregnancy period will help her a lot. And burning of Rakshogna Dhupas, Karpura are also suggested. This purifies the air and keeps virus free. In addition to this, she is advised to take daily bath and maintain personal hygiene. She should take adequate sleep and rest. She should avoid overexertion. If she is employed somewhere, she should opt for work from home facility so as to avoid exposure to the crowd or employment area. She should avoid roaming in crowded public places. She should buy groceries from reliable grocery stores where all the safety measures are taken care of. She should get updated pregnancy do's and don'ts information from reliable sources only. She should stay away from anger, grief, and too much of social media. She should avoid consumption of tobacco, alcohol, etc. so as to avoid the untoward complications of tobacco and alcohol like IUGR, like preterm deliveries. Then company of loving and caring family members should be there throughout the antenatal period and throughout the intrapartum period, and especially in the postpartum period of the lady. So this will keep the morale of that woman high and prevent complications like pregnant postpartum psychosis. She should avoid traveling to high-risk places and abroad. She should avoid sitting in prolonged discomforting positions. She should take periodic break from work. She should relax. She should walk in corridors and breathe in fresh air. Along with prescribed medications, she should take proper diets. So here are some diet tips for every pregnant woman. The food should be light, aromatic, freshly prepared, especially home cooked food, and it should be nutritious and wholesome. She should avoid packaged, canned, preserved food to avoid the transmission of infection. Then she should avoid stale and junk food. She should avoid binge or overeating or undereating. She should take proper diet on proper time. Daily intake of ghee is a must because ghee is supposed to be rasayana, balya, and it increases the ojas. It helps in boosting proper fetal growth, and also ghee contains vitamin D, then iron and folate rich food to counterbalance the hemodilution of pregnancy. Iron and folate rich food like green veggies, apples, dates, figs, fruits, pomegranate, raisins, bananas, gooseberries, carrots, oranges, etc. should be taken on every day. Regular milk and milk products like butter, ghee, buttermilk, curd for extra need of calcium and protein. And if non-vegetarian, she should take boiled eggs, fresh seafood, but avoid red meat. Then SwasthaVritta with milk to promote immunity, healthy weight gain, and SwasthaVritta is supposed to be a very great collector, means it maintains a proper production of milk. Then Ayushpath or turmeric milk instead of caffeinated drinks like tea, coffee, etc. If she is having nausea and vomiting like complaints, she can have dadinole, draksha, coconut oil. These are rehydrating and helps her to alleviate the symptoms like nausea and vomiting. If she is having bloating or gas trouble, she can have hingvashtak churna. If she is having constipation, especially in pregnancy, this constipation is very common complaint. This is due to the gravid state of uterus that presses on the bowels and delays the emptying of the bowels, and there is raised levels of progesterone which delays the intestinal emptying, and because they delays the peristaltic movement, and this results in constipation. So as to alleviate these complaints, she can take warm milk with ghee at bedtime, or she can have trifala churna with warm water. To conclude, every pregnant woman should stay alert, should stay hygienic, should wear a mask, should maintain safe distance, she should follow the guidelines, she should eat healthy and nutritious food, she should maintain her immunity, and pregnancy will be uneventful and will be rewarded with a healthy baby. Thank you.
Thank you very much, ma'am. Such a nice session. After if anyone have any questions, then they can ask to ma'am. Please, any questions? Any questions? इंटरनेटचा थोडा लॅप्स असतो. This is very nice session conducted by Dr. Snehalata Patil ma'am. The subject was COVID-19 management in pregnancy. Such a nice concluded ma'am. Such a nice sessions. More informative.
And thank you, Dr. Jadhav sir, and thank you everyone for watching and patiently hearing me.
Thank you, ma'am. Thank you so much. If anyone have any questions, they can put in a comment or chat box. Now, in our college, the administrative officer will talk with all of us. Dr. Shah, I request Dr. Shah sir to conclude this webinar. Dr. Shah sir.
नमस्कार. मनरा चॅरिटेबल ट्रस्ट द्वारा संचलित बीवी काळे आयुर्वेद महाविद्यालय माध्यमातून फायटिंग COVID-19 इन 2021 ह्या संबंधी आयुर्वेदाचा हेतू, आयुर्वेदाचे लक्षणं इत्यादी सगळी माहिती आमचे डॉक्टर राहुल जाधव स्वस्थवृत्तचे HOD आहेत, डॉक्टर नारायण जाधव रोग निदानचे HOD आहेत, हे उदगीर आयुर्वेद कॉलेजला आहेत, डॉक्टर नरेश कोळे हे काय चिकित्सा हेड आहेत पारुल युनिव्हर्सिटीमध्ये, तसेच सचिन टिके सर जे आयुर्वेद पंचकर्म विभाग प्रमुख आहेत गव्हर्नमेंट कॉलेज उस्मानाबादला, आणि डॉक्टर स्नेहलता पाटील हे आमच्याकडे HOD आहेत आणि स्त्री रोग तज्ज्ञ आहेत. अशा सर्व वक्त्यांनी येणारी घ्यावयाची काळजी याविषयी विस्तृत आपल्याला माहिती दिली. त्याबद्दल अजून काही शंका असतील तर तुम्ही आमच्या कॉमेंट्स बॉक्सवर टाका, ज्यामुळे आपल्याला त्याची उत्तर देण्याचा प्रयत्न आमच्यातर्फे करण्यात येईल. धन्यवाद. आपण सर्वजण उपस्थित राहिलात त्याबद्दल आपल्या सर्वांचे मनपूर्वक आभार.
Thank you, sir. Thank you so much. Now we all concluded this session. Here is no any questions for you, ma'am. So this is the end of our fighting COVID-19 in 2021 session webinars. So thank you everyone. Thank you so much.